morning, everybody, and welcome to our April 7th regular meeting. Thank you all for coming. Please call the roll.
Present.
Here.
Present.
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 We have Charlie Rael with us this morning to share a prayer from Mount Zion Tabernacle Church.
Let's all stand to our feet. It's a privilege to be here this morning. Anytime you can represent your local town or your local people and lift God up right in the middle of it, it's a beautiful thing. Let's all bow our heads. Precious Heavenly Father, we come before you today, God. And first of all, I want to thank you for this privilege. I thank you that you're a God who has ears open always, Lord God, to hear our prayers. And today, God, I lift up our town. I lift up our commissioners, God. I would pray that you bless them abundantly. I pray that there be unity and love amongst them like never before. I pray that 2015 will be a year of prosperity and peace and guidance by all our leaders, Lord. You're such a gracious God, and when we call upon you and we ask of you, hallelujah, you not only answer, but you deliver, you bring forth, you save, and you sanctify. I ask you to bless this meeting today, Lord God. Bless the ones that are about to participate right now. And I thank you for so much, and I ask your Holy Spirit just to bless and multiply the blessings in abundance. And everybody said, amen. 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 God bless.
Thank you very much, Mr. Rael. If we could remain standing, we'll just do the pledge now. And Councilman Gonzalez, will you lead us?
To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Mr. Chairman?
Yes.
If we could remain standing in a moment of silence for Lorraine Pacheco, Chamisal Senior Director, who was buried last week, and also for Rose Talardo.
Thank you. Thank you for that remembrance, Commissioner. Commissioners, do we have an approval of the agenda? I believe that there's one item that is repeated, 12A and B.
Mr. Chairman, Commissioners, we'll just go ahead and go with 12B, and we'll table 12A.
With that, Commissioners, is there a motion to approve the agenda?
So moved, Mr. Chairman. Second.
Yes. Yes.
Yes.
Yes.
Yes. Now we have citizens' concerns. Is there anybody in the audience who would like to address the board? And by the way, welcome to Councilman Gonzalez from the town of Taos. Mr. Hall, if this is a hospital item, would you hold it until that agenda item? I'm sure it will add to the debate. Are there any other citizens who would like to address the board at this time? Well then, if not, we'll move on to the minutes, approval of the March 17th, 2015 regular meeting minutes.
Mr. Chairman?
Yes, Commissioner O'Donnell.
Mr. Chairman, Commissioners, I would so move. We approve the agenda with a few additions.
At the agenda.
I'm sorry, the minutes. Thank you, Commissioner. It should read Pastor Joe Phillips from the First Baptist Church of Red River. And on page 8 of 36, it should read, the current ag exemptions call for resting of the land for 3 years, but House Bill 112 extends that. Thank you.
Thank you. Is there a second to the motion?
Second.
Any other discussion? Please call for the vote.
Yes.
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 Yes. On to item 7, awards and recognition. We have a presentation by Sheriff Hogrefe for exemplary service citation for Deputy Mauro Rosales and Deputy Jose Garcia. Sheriff, welcome.
Good morning, and thank you. Good morning, and yes, I am Sheriff Jerry Hogrefe for Taos County. It's my honor and privilege to be here this morning to pass along exemplary services awards to 2 of our deputies. I want to give you just a brief moment of background of what led to why we're here today to honor these 2 men. On March 11th of this year, Deputy Rosales received a call from dispatch with extremely limited information. That information was simply a man had called his sister, who lives in Florida, and told her that he intended to go to the Gorge Bridge to end his life. We had no vehicle description, no clothing description, only that he had brown hair and brown eyes. Deputy Rosales responded to that area and stayed diligent in his search. He ultimately located this individual at about 8 o'clock, and Deputy Garcia, who's here with us today to be honored on another event, actually backed him on that call. Through good communications, being nice, and verbal judo, he was able to talk this man into submission and ultimately got him to Holy Cross Hospital for primary medical care and then on to mental health services. In my opinion, clearly saving this man's life. And so it's my honor to recognize him for that heroic effort. 3 nights later, on March 14th, Deputy Garcia is going home at the end of his shift around 2:30 in the morning. As he crosses the Gorge Bridge, he notices a young man standing at the guardrail at one of the scenic overlooks. Simply recognizing that nobody sightsees at that time of the early morning hours in the darkness, he turned around to go talk to this individual, and this individual was intent on ending his life there as well. He was on his phone. He had talked to his parents. He was from Albuquerque. He had talked to his parents and told them, I've got my ID so they'll know who I am when they find my body. I've left the keys in the car for you so you won't have trouble getting it. And as Deputy Garcia approached him, he actually calls 911 to tell them the same thing. Deputy Garcia gave him some distance, used extremely good counseling techniques and verbal judo, and in his estimation said, you know, he talked to him for 20 minutes when in actuality the time distortion was much shorter than that. But this young individual was very intent on ending his life that night. Deputy Garcia was able to talk to him in a calming method, get him to step away from the rail, get him to sit down, and one of our deputies, Nicholas Lamondola, arrived as his backup. Shortly after the second deputy arrived, that young man amped up again and actually went towards the rail, and they had to physically go hands-on to restrain that individual, ultimately taking him to Holy Cross Hospital for primary medical examination and then on to mental health services. So it's my privilege today to present plaques and pin both Deputy Rosales and Deputy Garcia with life-saving pins that they will be able to proudly display upon their uniform as part of their regular uniform for the next 30 days, and then those pins are theirs to keep for the remainder of their career. So with that, law enforcement services, and it's my privilege, Deputy Rosales, to pin you with this award and your certificate. Thank you for your service. Deputy Garcia, it's my privilege to pin you as well with the life-saving pin, the colors of red and blue, to signify law enforcement service. And to present you with this plaque for exemplary service. Thank you.
get the commission to squeeze in. Thank you, Sheriff.
I always spend my toes when I can.
Thank you, gentlemen.
Thank you, everyone. And I almost forgot, on my dime, I'm going to give each one of them a subway card, because, you know, the cops love me. That includes one for Deputy Nicholas Lamandona, that's not here today, for his being second to on that.
I just wanted to say that as a county commissioner, I am hearing some really good, positive things about our sheriff's department, and you know, you've definitely delivered on your word, Sheriff Hogrefe, to the residents of Taos County, and I appreciate that. But also the deputies, they're doing an awesome job. They're out everywhere. They're protecting the community, and so thank you very much again, and God bless you.
We definitely appreciate our sheriff's department, and today especially these young officers having saved lives and really done exemplary work. So thank you very much. I know Mr. Mauro's mother is in the audience, Cherry. Nice to acknowledge you, and I don't know any of the other relatives, but thank you all for coming. Yes, sir, in the back.
Father.
The father.
Mauro, Senior.
Oh, hello, Mauro. I didn't recognize you back there. Well, thank you for coming, everybody, and thank you for your work. We have a presentation now of Taos County new employees, and this is given to us by our Human Services Director, Renee Weber.
Good morning, Chairman and members of the Commission. Unfortunately, we didn't have a very good turnout for new hires this morning, but please join me in welcoming and very graciously introducing Mr. Jose Mondragon, who is with our Emergency Communications Department. Mr. Mondragon came to us from Rio Arriba County. Before that, he worked for the town of Taos as a dispatcher. So we're very pleased that we are attracting experienced individuals. Also for new hires, the County Assessor's Office, Anthony Mondragon, took a promotion as a GIS Technician 3. For the Adult Detention Center, Ms. Andrea Oliveira is the new Operations Lieutenant. Mr. David Sees is the Detention Clerk. The Road Department has Mr. Francisco Sanchez as our Road Maintenance Operator for District 5. The MIS Department has the addition of Carlos Valdez as the MIS Technician 1. And the Sheriff's Department has 2 new hires, Mr. Gilbert Atencio as a deputy and Mr. Elias Montoya. Those are all recent new hires for Taos County. Thank you.
Very good.
Thank you very much. Welcome.
Mr. Chairman, Commissioners, we will make sure that we have prior notice to the individuals so we can have more of them here at the next meeting when we introduce them.
Sounds good. Thank you, Steve. On to item 8, presentations. We have a presentation by Steve Rozenboom, Chief Financial Officer, and Sydney Bradley, Interim CEO from Holy Cross Hospital. Welcome, Steve. Going to bombard us with numbers?
Maybe a little bit. Thank you. Good morning, Mr. Chairman, Commissioners, and staff. The first few slides that I have here are kind of background information and represent the volumes at the hospital the last couple of years. The first slide here is our inpatient admissions, and keep in mind that hospitals have historically been built to service primarily inpatients. Also providing some outpatient services, but primarily for inpatient. So the infrastructure of the buildings, staffing, et cetera, are set up for inpatients more so than anything else. We've seen a change in our inpatient admissions, as have most hospitals across the country. We're currently percentage of our revenues is down to 27% of our revenues are associated with inpatient admissions. 73% is outpatient services. As recently as 2008, we were 51% inpatient revenues versus outpatient revenues at 49%. So this is not atypical. It's very common across the country, and you can see our decline in inpatient admissions on this chart over the last couple of years. Inpatient days have also declined, but not quite at the same rate as the inpatient admissions. This might suggest higher acuity patient that requires a longer stay, but not always. We've had a lot of difficulty in the past few years transferring patients to skilled care facilities, transitional care, long-term care, nursing home, that kind of thing. So bed availability has been limited as well, and that leads to a longer inpatient stay because we can't just discharge them to the street if they need additional medical care. Our average daily census has declined. This is a representation of the number of patients that we have at midnight on a daily basis. So that also shows a decline. Our third quarter of this year, and our fiscal year begins in June, so it's a little goofy when you start looking at these quarters. But our third quarter was down a little bit from the past couple of years. We didn't have a big flu season, so that limited some of our inpatient activity. One of the reasons inpatient has changed also is a drive-by Medicare shifting patients to more of these outpatient services, including observation days. Even though in many cases observation days require similar levels of services of inpatient, we get reimbursed less for observation days. A couple of things have driven that: medical necessity and recovery audit contractors have been taking back money that they take a look retrospectively at our admissions and say, that should not have been an inpatient, that could have been done some other way. So we have to work much more diligently in identifying the specific medical necessity to make a patient an inpatient. And there's a 2 midnight rule now that was effective a couple of years ago that requires a physician to certify that they expect the patient to be in the hospital for at least 2 midnights in order to admit them as an inpatient. So those types of changes are driving more and more things to outpatient services, including observation days, as you can see on that chart. You can see the outpatient visits have increased. Outpatient volumes include imaging, laboratory, wound care, ambulatory surgery, diabetes management, anticoagulation, things of that nature. So we have seen increases in those. A lot of those are preventive care type things also, which also help keep patients out of the hospital as an inpatient. Our ED visits have been very strong. We're on a record pace for this year. This chart represents versus last year 2 patient visits per day in the ED. With some of the difficulties that Tri-County is having, we expect some of these volumes to increase, unfortunately. But if they can get things back in order on their side, that will help reduce the number of ED visits that we might see from some of those patients. As the sheriff pointed out earlier, those suicidal patients generally get transported to the hospital, but then we don't provide mental health services, so they're usually transported out from the hospital, but they do go into the ED for the evaluation. Surgery visits have been very strong. You can see a dip in the second quarter, the red line, in the second quarter of 2013. That's when we had the general surgeon turnover at the hospital. So our surgeries dipped quite a bit. We recovered. Last year we had a fairly strong year in surgeries, and this year, again, we're doing very well on the surgeries. The dip in our third quarter, we had a couple of physician absences. We do expect volumes to recover a little bit in the fourth quarter. However, the retirement of Dr. Citrullo and Dr. Killer leaving Family Practice Associates will impact those surgery numbers a little bit. Dr. Killer does a lot of endoscopy procedures in the OR. With regard to our revenues, we have seen some improvement in our net patient revenues. Net patient revenues is basically the cash that we expect to receive for each patient visit. Depends on a lot of factors, whether it's an inpatient versus an outpatient. We get better reimbursement on the inpatient side than we do on the outpatient side. Payer mix has a significant impact. So if we get primarily Medicaid patients, that is our worst payer, versus commercial, which is a much better payer. And so payer mix changes from month to month, day to day, and that impacts what we expect for net revenues. Patient acuity, how sick the patient is, can impact the revenues. The patient's ability to pay, we evaluate, and charity care is removed from our revenue services as required by CMS. Bad debt, safety net care pool funding, there's an element of that funding mechanism that changes the base rate that we get paid from Medicaid, excuse me. We also get lump sum payments through the safety net care pool, but what affects the net patient revenue is the base rate adjustment that we get on those inpatients for Medicaid. There are also federal funding changes, and I'll talk about those more at the end of the presentation. The decline at the end of the last year, the brighter blue line, was a result of a couple of audit adjustments that we don't expect to have again this year. Lower volumes also contributed to that decline in the fourth quarter of last year. So those audit adjustments, as I mentioned, we don't expect to recur this year, so it should be a much better fourth quarter. There are a couple of slides that I was unable to get into the presentation, but I do want to talk about a little bit. Payer mix, which I mentioned on the previous slide, has been a concern for us. With the implementation of the Affordable Care Act, a lot of the legislation associated with that in January of 2014, we saw a significant shift in the mix of our payers. Prior to January of 2014, we averaged about 15 or 16% of our revenues were Medicaid. About 35 to 36% of our revenues were associated with commercial payers, our best payer, or our best group of payers, I should say. Since the Medicaid expansion that the state of New Mexico participated in, and the health insurance exchange and things of that nature, that has shifted from 16% of Medicaid up to almost 30%. Just under 29% of our patient revenues are now associated with Medicaid. At the same time, we did see a reduction in our commercial payers down to about 29% as well. So we have about the same amount of commercial patients as we do Medicaid patients from a revenue standpoint.
Excuse me, Steve, so what's the Medicare percentage?
Medicare is about 40% right now, and it had been about 42%, so that hasn't changed significantly. The other area that did change significantly was self-pay. We saw a significant decrease in our self-pay revenues or revenues associated with self-pay patients. It dropped from about 10% to about 4% right now.
And what's the remainder?
That's 100%.
Really? 4?
Close, should be close.
75, yep.
Yep. Thank you.
The reimbursement by payer class is another slide that I didn't get into the presentation, and it's an important one to note because of the payer mix. Self-pay patients, and self-pay as it's represented, or as I'm speaking about it, is not just patients without insurance, but it also includes the copays and deductibles that other patients might have. So we actually have a fairly decent reimbursement on self-pay patients. It averages about 55% of the charges. A lot of the self-pay patients that are completely uninsured and self-pay become charity care or might go to bad debt. So when it goes to charity care, that's not represented in that 55% reimbursement level. Our best reimbursement, as I mentioned earlier, is commercial payers. And right now we're receiving about 70% of our charges from commercial payers. It's largely driven by our outpatient contracts with those payers where we get between 77 and 90% of our charges are paid on the outpatient services. So that's a good thing. We've got good, strong contracts on the outpatient side for our commercial payers. Medicare pays us about 40% of our charges. Medicaid pays us about 30% of our charges, which is an increase from the 27% that we did have, and that goes back to the safety net care pool base rate adjustment that was made last summer. So we've seen an improvement, but it's still only about 30% of our charges, less than half of what we get from a commercial payer. So if I go back to that payer mix discussion, we've seen a 12-13% increase in our Medicaid patients, which is our worst payer. At the same time, we've seen about a 8 or 9% reduction in our commercial payers, which is our best payer. So that clearly has a negative impact on our net revenues.
So do all the revenues from bad debt fall into either Medicaid or Medicare in that breakdown?
No, most of our bad debt is going to be the residual of copays and deductibles that our insured patients
So commercial.
can't pay. Primarily commercial, not completely. There are Medicare and Medicaid, not Medicaid because there typically is no copay or deductible with Medicaid services. But for Medicare, there's inpatient copays and outpatient copays and deductibles as well. And some of those are reimbursed through the cost report, but that's one of the changes that the federal government has implemented that reduces our ability to recover some of those bad debt. Our operating income first, the operating expenses. I think I skipped a slide there. There we go. So we have made a number of changes in the past couple of years that have resulted in decreased operating expenses. The third quarter, we have seen some increases this year. We've had some unanticipated locum tenens or physician temporary type employment increases, and we've had some legal expense increases that were not anticipated when we did the budget and versus last year. Most of our large categories of expenses have seen decreases. Salaries and benefits are our largest cost at the hospital, representing 53% of our total costs. We've seen a 4.7% decrease in salaries and wages versus the previous year. Some of that, however, has just simply moved from salaries and wages to purchase services as we've contracted for different things like the hospitalist program and things like that. Supplies are about 11.5% below budget. And other purchase services, even though we've seen increases from the hospitalist program that shifted from an FTE base, they are also down about 3% from budget. The other purchase services, and you'll see that in a couple of slides here, includes a lot of expenses associated with grant programs, contract labor, temporary nurses, temporary physicians, as I mentioned. We contract for MRI services. Most of our ED physicians are contract labor, so they all fall into this category. With the improved net revenues that I showed a couple of slides ago and decreased operating expenses, you can see on our operating income that we've been much more stable this year. Unfortunately, we're still reporting a loss. It's better. It's much better than it's been the past couple of years, but we are still reporting a loss. And so we continue to look at ways to enhance our revenue and decrease our expenses. And I'll have another slide in a moment that talks about some of those additional changes that we've made to decrease expenses. EBITDA, if you're familiar with any accounting, and I don't want to get too much into accounting-ese kind of thing, but it's more of a cash flow type of representation of the operating income. We remove taxes, depreciation, amortization, and interest from the income statement, and that results in what's known in the accounting world as EBITDA margin. The largest adjustment for Holy Cross is removing the depreciation, which is about $2.7 million annually. So while we're showing a loss on a regular basis, as shown on the previous slide for operating income from an EBITDA standpoint, we've been positive all year. And we do expect a positive result in the fourth quarter as well. It's not truly a cash flow representation, but it does have a better representation of how we're doing cash flow wise than what the operating income might suggest. Talk a little bit about our cash position. We've really struggled the last couple of years. The safety net care pool funding has been very welcome, but it's been inconsistent in when we receive it and how that impacts our days cash on hand. This chart's a little bit deceiving because it suggests that we have 24 days of cash on hand, which we did at the end of February. But we've been able to accomplish that by pushing out our vendors. And that's not a really good way to do business. They're not happy with it. They'll start holding shipments of things that we need or place us on COD or not even allow us to place an order. And I'll show you that slide in a moment. We did in March, at the end of March, we have a line of credit that's collateralized by investments that we hold. We can borrow up to 50% of our investments. We're nearing that cap. We've borrowed almost half of what we have invested. That allowed us to, at the end of March, reduce what we owed our vendors down from about 78 days down to about 60 days. We were hoping to get a safety net care pool payment in March that would have allowed us not to tap that line of credit, but we have not yet received that, anticipating that in the next couple of weeks. You can see here how we've been able to manage our cash level at 24 days. And by the way, for a healthy organization that's similar to ours, a baseline would be a minimum of 80 days. And a good benchmark, a benchmark that Quorum Health Resources uses is 136 days for an organization like Holy Cross. So we, after making the payments to the vendors last week, we're down to 13.5 days. Not a healthy position at all. And you can see the 77 days that we had our vendors at the end of February. As I mentioned, I don't have the final numbers for March, but I expect that to be closer to 60. Once we receive our payment from the state for the safety net care pool, which should be about $1.2 million, we should be able to get most of our vendors current, which will help a lot. Doesn't leave us in a great cash position because we might receive the 1.2, but we're going to spend it pretty much all at once. The next payment will come in June, so hopefully we can pay back some of the line of credit that we've borrowed against. From an FTE standpoint, you can see we've been pretty steady with our FTEs. What this chart does not represent is some of the additional staffing that when we hire a traveling nurse or something to cover for peak volumes and that kind of thing. But the actual employed FTEs in the hospital has been pretty steady, just over 310. This income statement shows the history for 2013, 2014, a projected 2015, and an estimate for 2016. We're right in the middle of our budgeting process. I hope to do better in the budget than what's represented for fiscal year 2016, but I wanted to show the difference between the 2015 projected and the 2016 estimate because it represents some of the changes that we've made in the past few months with regard to reducing expenses further. And as I mentioned, I'll have that slide. I think it's after this next one. For our capital needs over the next 3 years, we've done a couple of things in the past few months. We had an extensive engineering review of our plant operations by an engineering firm, looking at building infrastructure, including structural components, HVAC, electrical, plumbing. That's mostly what's represented in the plant operations over the next 3 years. We also did an extensive review of our clinical and other equipment repair and replacement needs. And we define capital for the hospital as a project that costs at least $2,000 and has at least a 2-year useful life. So the extensive review that we did, we looked at every piece of equipment that's currently on our balance sheet. The managers did an evaluation of when that equipment would need to be replaced. And sometimes we don't have a choice on when to replace the equipment. If the manufacturer will no longer service and support that equipment and it's something that's needed, for example, a lab analyzer, we have to replace it with a newer model. So we have pushed out as many things as we can. Last year, we only spent $460,000 on capital replacements. This year, year to date, we've spent $1.2 million. In 2013, we spent $1.3, and in 2012, we spent $2.2 million. So you can see that we've been declining up until this year, had been declining. We've had a lot of capital needs this year that were required to be replaced. For instance, we had a boiler failure and we needed to replace that.
So something less than half of these totals are within the cash flows that you've been running? Because
Correct.
so about half of that is what you can currently afford to pay, assuming that things are on an even keel.
Right. We would like to be able to replace equipment at the same rate that we're depreciating it. And we're depreciating about $2.7 million a year, but we're not replacing it at that rate. So we fall further and further behind.
Clearly. Oh, on that IT, there was a mention at the committee meeting that there was a need for new software that could cost up to $6 million. How does the IT line of your capital needs fall into that?
Well, I don't have that in this particular forecast because it's largely unknown. As Todd mentioned at the meeting, our primary patient information system is called Meditech, that's the name of the company that provides that. The platform that we're on is called Meditech Magic. There are a large number of hospitals with HCA, which is a healthcare organization, that also utilize the same software. If they elect to move to a different platform, it is unlikely that Meditech will continue to support Meditech Magic and they would sunset that. And if that happens, that would probably cost in the order of $6 to $10 million.
And who's HCA?
You know,
It's a proprietary.
Is that statewide or nationwide?
that's a national firm
You know how
based
many-
out of Nashville, Tennessee.
Do you know how many hospitals currently use Meditech Magic?
I don't know the answer to that. I think Todd would know the answer, but I don't.
And so these line items are mostly equipment, IT equipment?
Yes, and telephone. Our telephone system's going to be sunsetted in 2017, so that's a pretty large expense to replace in a hospital setting.
Thank you.
Okay. Here are some of the expense reductions we've taken in the past several months. With our interim CEO, Cindy Bradley's guidance, we've been doing a lot of contract revisions, reviews, and analysis. We've saved, through those specific contracts and some others, probably $625,000 annually on those contracts. We've eliminated some management positions that will save us $280,000 in salaries and benefits. We closed the Penasco Clinic, saving us roughly $150,000 to $160,000 annually. We've done some other belt tightening, reducing travel expenses and things like that. We've terminated a management contract that we have with South Central Colfax Special Hospital District. That's primarily a nursing home in Springer and a clinic in Cimarron and a clinic in Angel Fire. And we've provided management services for them in the past. We do receive a payment from them of about $9,000 a month, but we're probably spending in the order of $14,000 to $15,000 a month to support the requirements of that contract. So it was a 5-year contract that we elected not to renew. We've also been negotiating higher payment rates from the commercial insurers, but when that's only 27% of your business, it's very difficult for that to make a big impact without trying to get a 20 or 30% increase. We did manage to get a 30% increase from Blue Cross last year on the inpatient side, but that was an unusual circumstance. The next several slides are addressing some of the reductions in reimbursement that we've been faced with from CMS or Medicare. The first one was effective last Wednesday, and it's a 16.5% reduction to our inpatient rates for Medicare patients. Associated with low volume payment adjustment is what it's called. Now this is a program that's been around for a number of years. The funding for it has gone up and down. It's always been tied to the sustainable growth rate formula, or the doc fix that you may have heard about in the national news. The House has passed a version that would reinstate that low volume payment adjustment, but the Senate is still debating it. So we don't know the outcome of that. Unfortunately, whatever they decide, even if they do reinstate the program, the mechanics of getting it in place, we probably wouldn't see any cash from that until the October-November timeframe. We need the cash now, so that really hurts us to have that 16.5% reduction. Other legislative and regulatory changes that have already been passed and are associated with the Affordable Care Act are listed there, and they total about a 10.8% decrease over a annual decrease over a 15-year period of time.
Are you projecting that under the reductions that have already been passed, it's that you're going to be able to make up the reduction in revenues in other ways? Are you projecting steady cash flows going forward with these already passed reductions accounted?
Well, some of these took place already in 2010, so we've been dealing with them already for 4 or 5 years. We're trying to make adjustments. We're trying to improve our commercial payers, as I mentioned just a moment ago. We're looking at reducing expenses also, but to offset the revenue is challenging because there's basically 2 ways to do it. You can increase your volumes, and we've seen some volume increase, especially on the outpatient side, or we can enhance the revenues that we get from the commercial payers. We don't really have the opportunity to negotiate with Medicare or Medicaid. We get what they decide to pay us, and that's 70% of our business.
Well, to keep it simple, what are you projecting for next year's cash flows relative to current?
I expect them to be positive. I don't have a definitive number at this point. As I said, we're still working on our budget. I expect it to be positive, maybe between $1.5 to $2 million positive cash flow.
So that's steady.
As you saw on the capital slide earlier, that's not enough to cover our capital needs.
I understand.
But it's steady. It's steady improvement, but nothing gigantic, just steady.
Mr. Chairman, Commissioners, the 16% federal cut reduction,
Correct.
That could be reinstated if the Senate passes the same bill that the House passed. Is that correct?
Correct.
Okay. So this is kind of a moving target, the 16%.
It is.
Okay.
And even if they passed it today, like I mentioned, we probably wouldn't see the results of that in our cash until probably October or November.
But your projections don't include those reductions to be in effect?
Yes, that particular reduction, yes, and the 10.8%.
Do you have those in your projections?
In that, if I can back up to in that 2016 estimate, yes, they're included in that. There are also additional cuts that are being proposed that would have an additional 17.3% reduction to our revenues. Again, these are still being debated. Nothing has been passed with regard to these, and I'll show you some detail on the next couple of slides. So this slide shows the relative magnitude of each of the cuts that have already been made. Most of the green areas on this chart represent administrative type cuts. The orange represents some coding cuts. Without getting into a lot of detail on how CMS does things, they decide that this is how we're going to pay things based on what we expect to happen with coding. The blue, which is the much larger area, are the proposed cuts that we've not yet that have not yet been implemented. And keep in mind, these are all over a 15-year period of time. So when it shows $28 million for the rural health cuts, that's over a 15-year period of time. So it's about $2 million per year, if it were implemented.
Steve, if I could ask a quick question, Mr. Chairman, Commission. On the coding, is that Medicaid coding? And the
No,
new,
this is all Medicare.
okay, so it's Medicare coding and the new regulations on that. Have your staff been certified in the new coding regulations? And what?
Yeah, ICD-10 will be implemented in October of this year.
Okay.
And they're working through the training processes now, so we're pretty comfortable with that. These particular coding changes are whenever CMS changes an inpatient scale, for instance, and they did this in 2011, they changed the entire inpatient scale. They, in my opinion, it's a bit arbitrary, but they allege to have lots of science behind it. When they make a wholesale change, they'll impose an adjustment because they anticipate hospitals and physician practices are going to code differently, and they're trying to establish a budget neutral change. So if they upcode, they'll get paid more.
Right.
So they make an arbitrary adjustment to reduce the reimbursement.
Mr. Chairman, Commissioners, Mr. CFO, a lot of these issues regarding federal cuts, if we could work with you in writing our congressional delegation to not make these cuts. I know in a previous conversation with Ms. Bradley, when El Centro was worried about drastic cuts of up to 60% in their clinic, it was mentioned that it was not probable that those cuts would be made, and we've seen the House pass it, Senate's still going to, but this is just a thought that if you could be in contact with us and help us write letters to our congressional delegation, because again, these cuts are moving targets, and we can help with at least putting pressure on our congressional delegation that these cuts not happen. Thank you.
Yes, I'd be happy to do that. And we work closely with the New Mexico Hospital Association and the American Hospital Association on some of those things as well. They do provide some lobbying services as well. So they would be helpful in that manner as well. Another thing this chart does not reflect, however, is impact on Medicare Advantage plans, which is the commercial arm of the Medicare program. So any cuts that might occur on the Medicare side may also flow through to the Medicare Advantage programs. Not necessarily, but in a lot of cases they do. So that's a smaller part of our Medicare population. It's only about 20% of our Medicare patients get their services through an Advantage plan. But it would have an additional impact. Also not reflected are potential increases that we might see because of the expanded healthcare coverage through the health insurance exchange and expanded Medicaid services. So these don't reflect any potential increases that we might receive from those programs. This slide provides the same information in a little bit more detail. There are kind of two windows here. The left side are cuts that are already in place, as I mentioned before, with the green and the orange. And the blue are cuts that are proposed but not yet in place. And the biggest piece of the proposed is the rural cuts. And that's primarily the disproportionate share in sole community hospital payment add-ons that we get from Medicare that are kind of on the cutting room table that could potentially result in a reduction in our reimbursement. This chart is just a compounding of those cuts, as noted before. The first 5 years are cuts that we've already been faced with, and the remaining 10 years are the proposed cuts. And again, just a little bit more detail. I know that at the study group meeting, someone asked what OPD stood for, and that stands for outpatient department. So it's not just inpatient activities that are being challenged, it's outpatient areas as well that we face payment reductions. I hate giving such a gloomy report, especially after the deputies were recognized for their outstanding service, but that's kind of where the hospital, Taos Health Systems is, and I think it's important that everyone be aware of our financial position.
Thank you for the presentation, Steve. The 72% of your revenues that's Medicare and Medicaid, how does that compare to other rural hospitals?
I can't answer that within the state of New Mexico. I'm not certain. I could probably get that information. Nationally, I think it's a much higher percentage, especially on the Medicaid side. We have a very high Medicaid population, and within Taos County, we have a very high Medicaid population. So I think it's probably higher, that ratio is probably higher for our hospital than it is for most other hospitals in the state of New Mexico, and certainly nationally. My experience at 2 other hospitals that I've worked at, we had Medicaid levels at the 4 and 5% range, and not the 25 to 30% range. And Medicare was usually in the 30%. So we're much higher for our population.
Yeah, the numbers that I saw from Community Health Systems, which owns 206 rural hospitals in the country, their averages were closer to 45, 50. So I'm sure that that's a burden on the hospital, the fact that we do have a relatively large percentage of our population utilizing Medicaid and Medicare. I think you've done a good job in raising your cash flows, and I expect you'll continue to do so. It's never a job that's completed. I know that the availability of in-town doctors affects your revenues, and I'm sure you're recruiting doctors and seeing if you can build those parts of the hospital's business. What's your occupancy rate now?
It's off the top of my head, I think it's in the mid 40% occupancy. We're licensed for 29 beds. Our average daily census is about 16, higher than 40%, but they're not occupied all the time.
So I think averages are closer to 49. So, you know, whatever it takes to raise the occupancy rate to a better level. I don't know if that's possible, but obviously those are things that are always under consideration by management to try and improve the cash flows. It is clear to me, you know, there's a whole value set to all of the equipment that goes with running a hospital and with outpatient services, and that value is supposed to be more or less shown by depreciation, and the value of the required maintenance and replacement of the equipment is supposed to be shown in annual depreciation, which is running $2.7 million, and the most you guys are able to come up with is $1 million. So, you know, it's clear to me that you're falling behind. I was encouraged by the dropping of the expected expenses over the course of 3 years, but it seems to me that you guys really need $5 million to bring your operations back up to safety levels, service levels where you can effectively serve the community. And, you know, there's only a few possibilities there, I guess. Some of them are the hospital's responsibility, like raising funds from private donors, applying for grants, lobbying in the state legislature, all of those kinds of things that I'm sure that the hospital is concerned with. But the only other way to come up with that kind of money would be a mill levy. And I'd be curious to know what the number is for Taos County. We have about $1 billion worth of property values in the county, which is very high relative to the Medicaid, Medicare aspect of running your hospital. In other words, we're a poor community, but we happen to have a high value on property because of mostly second homes and the ski valley. I'd be curious to know what increase in the property value of per $100,000 would be required to sell $5 million in bonds. And I guess that's something that we've looked at in the past, but it's a number that is important for us to know.
Mr. Chairman?
Yes, Commissioner.
Commissioners, well said. I do have a few questions, if I may.
Sure, please.
Your safety net care pool, how is that calculated in your revenues? Where does that show up? You receive, is $7 million a year?
$7 million through a combination of base rate adjustments, which would be reflected in the net patient revenues, and roughly $5 million in lump sum payments that are spread out quarterly.
So is it
providing the state funds the program at the same level that it did last year?
Well, I believe it didn't sunset, so I
has.
think they will.
Still working on the applications that were submitted in December.
Where does this show up in your net patient revenues? Is that where we see that figure?
No, the
Where is-
lump sum payments would show up in other income. So if you look on the income statement portion, or the slide that I had with the income statement,
Okay.
that's where that shows up. So there's $6 million of other income that's not patient-related. Technically, the safety net care pool is related to patients, but I can't tie it to a specific patient. Because
All right,
it's
so
paid in a
which
lump sum.
page, just for my, that would be, which, could you pull up that graph, or just so I know where it is? Okay, thank you. And again, what is the reason the payments are late? Is that HSD that's giving you the payments? Who gives you the
Yep,
the check?
it's HSD that provides the lump sum payments.
What's going on there? Why they're late?
The applications were due at the end of December. Not every hospital had their application turned in. And once HSD started looking at the applications, they had some additional questions. This is the second year of the program, so they haven't ironed out all their bugs yet. Our application was submitted on time. They didn't have any questions about our specific application. They're hoping to make payments by the middle of April. And then after that, they expect to make payments within the quarter. So then we would see additional quarterly payments in June, September, and December, more timely.
Do you think it would be of any value if the commission were to write a letter to Mr. Brent Ernest that we're concerned about the hospital lagging in their payments to vendors because of the late payments from HSD? Is this something that would be helpful?
I don't think so at this point, because I think they're far enough along that the payment truly is imminent, and it's just a matter of waiting maybe a week or two for that payment to arrive.
All right, and then could you please tell me what your new CEO, Mr. Bill Patton, will be making a year?
I don't know that answer. That's
Whatever Cindy's making plus what?
Could you get that figure for us, please?
I can ask for it, yes. I mean, it's personnel, private information, and I don't know if quorum wants to disclose that or not. I don't know.
Is the average range like 250, 300? Is that about? It seems to me that we had discussed something in that
Might be on the
range.
high side, but I truly don't know. I'm not a CEO, and I don't receive CEO wages, so.
I guess I'm having a problem with why that salary would not be disclosed, since the county owns the hospital building, and I guess it's not a public hospital, but it is run a nonprofit. But I would appreciate if you could find that out for me, if there's any way you could find that out.
I'll communicate that to, that request to Ron Burnham, our board chair.
I'd like to recognize Miss Jeannie Masters. She's from the THS board. Thank you, Jeannie, for being here. And I don't know, correct me if I'm wrong, are you running again, or you're retiring? All right, well then I'd like to thank you for your years of service on the THS board. How many years were? 20 plus, and I'd just like to thank you for all the effort you put in, and thank you very much. That's all, Mr. Chairman.
Ms. Bradley, would you like to address the board? You don't have to. I just, your name was on and you're here joining us probably for your last meeting.
My name is Cindy Bradley, and I'm the interim CEO at Holy Cross Hospital. I would just make a couple of comments to follow up on Steve's presentation. I think they're important. And so the first one is about cash flow. So Steve's answer to Mr. Archuletta's question about ICD-10 preparation. We've worked a lot and we are prepared, but it will impact cash flow. And my concern is, and for those of you who don't know, it's an entirely new coding system that's required of all providers, physicians, hospitals, everyone who submits a bill to any payer. And so my concern is when it comes into effect in October, we may be prepared and we may submit a bill with the appropriate new ICD-10 codes. But if the payer that we submitted to is not ready, if they don't have their computer systems all prepared to accept this new coding, if they don't have staff that is prepared and understands and that sort of thing, what's going to happen is those payers are not going to pay timely. And so they'll stop the bills and we won't get paid. And I think every provider in the country needs to be very concerned about their cash flows come October and the following months. So think about our third-party intermediary for Medicare. If they're not able to, if they don't have the software in place, if they're not able to pay these bills, what it would do to a hospital like Holy Cross. And particularly if our days cash on hand is 15, 16, 17 days, and then we have one of our major payers say, well, we can't pay you for another 60, 90, 120 days. That will really place Holy Cross and other hospitals in a very, very difficult position. The same thing with respect to the 16.5% that we were looking at. The Senate may very well approve that. But the problem is, starting last week, April 1st, that cash flow that we were regularly receiving, it's now put on hold until the Senate approves that. And that's assuming they will approve it. But if they do approve it, then there will be another delay. That cash is not coming in. And remember, we're sitting at 15, 16, 17 days cash on hand. We have to have every penny of that money coming in.
Mr. Chairman, Commissioners, Mr. Archuleta, could you help prepare a letter to our congressional delegation about the urgency of this?
If that's the will of the commission, yes, ma'am.
I'd like to make a couple of other comments. At the study group last week, and again today, I think Mr. Blankenhorn was maybe making reference to the hospital looking at other revenue streams, and certainly that's important. And it's important in terms of creating new jobs in the county. And hospital jobs are good jobs. They're benefits, good pay. But it takes money to do that. So to recruit physicians, it takes cash. And right now, we are strapped for cash. I think another piece of this is that the payer mix is still the payer mix. So we can create new services that in many other hospitals would be profitable and bring in cash, but because of the payer mix here, it's not going to be as profitable and it's not going to bring in as much cash as it would in other locations. So I wanted to make those points. I'd be glad to answer any questions.
Mr. Chairman.
Points well taken, Cindy, and you know, it illustrates why really 60 days cash is a big difference in the way you conduct your operations. And is it like $1.5 million per 30 days? I can't remember what the numbers are. More or less? No?
Oh, it'd be more.
More.
More on the order of $3 million to $4 million for 30 days cash.
Mm-hmm. Right. So there's another $3 million shortfall to get to a below standard, but at least somewhat comfortable cash reserves where you could operate the business in a better fashion.
Mr. Chairman, Commissioners, Ms. Bradley, thank you so much for always being here. We have disagreed on certain issues, but I do appreciate you being here. And where's the movement towards telemedicine? As much as I hate it in the jail, would that be a way to cut costs? I know you have there's a coding problem to bill for telemedicine, but could you maybe give us some perspective on what you think about telemedicine and how that might cut your costs with doctors? Maybe if you could just comment about where that is in the future.
I'm not really sure that how it would impact the hospital's cost structure. We currently are finalizing arrangements with the University of New Mexico for both a pediatric telemedicine as well as a neurology telemedicine program. I think it's less about saving money and more about adding some clinical expertise and having that available to physicians who are at Holy Cross, improving patient care.
Thank you.
Well, Cindy, thank you so much for your service to Taos County. How long were you here?
Till Monday,
And how long were you here? I can't remember.
December 1st,
3.5 months. Well, I know you made a lot of important moves during those short months. It makes me wonder why some of them weren't done sooner. And it makes me hope that your successor will follow in the path that you set. So.
Bill Patton and I have been talking weekly, and he's anxious to be here, and we'll be here Monday.
Well, we look forward to meeting him. Thank you. And Jeannie Masters, would you like to address the board? No? Well, thank you for all of... The hospital is a critical part of our community, and thank you so much for your decades of service on the board. Well, Commissioners, with that, I guess we can move on to our next presentation.
Mr. Chairman, I do believe Mr. Hall had some comments.
Oh, I'm sorry. Mr. Hall.
Stevens Hall. My concerns are many, and I'm not really sure where to begin. So I will go back to the meeting of March 24th. At the commission meeting on 24 March, the board asked that the lease with Taos Health Systems Incorporated be researched to answer questions regarding a yearly $80,000 payment required by Section 4B of the lease with THS, and that the matter be included on the agenda of the next meeting, this meeting. That matter is not on the agenda, so in case the questions and matter have been forgotten, I'll do some refreshing. The 17 February commission meeting, I expressed concerns about Taos Health Systems Incorporated and questioned whether provisions of the lease with Taos County were being honored. I spoke of a $770,000 10-year prepayment by THS to Taos County to inappropriately, I say, if not illegally, leverage federal dollars in order to receive increased sole community provider funding. I spoke of THS's denial of access to their board minutes and clear and unequivocal contravention of their written corporate bylaws that had originally been required of THS by this body when the 1992 hospital lease between the county and THS was drawn. I asked specifically if yearly $80,000 payments to acquire medical services equipment to be used in providing healthcare-related services to the residents of this community as required by Section 4B were being made. At the end of those expressed concerns, Mr. Blankenhorn said, and I'm quoting now, quote, "You bring up some interesting points," and I'm sort of summarizing the highlights of his comments. And again, these are all quotes. "It was my impression that minutes would be open to the public. We'll look into that. I'll personally look into that. As to the $700,000 payment, you know, that was done. They accelerated all their rent payments so they could get the tripling from the federal government back then. It was a device that everybody came together to use because Holy Cross was in such difficult shape. I wonder about that device, who everybody was, how that decision was made, and how the decision was arrived at." Back to the quotes of Mr. Blankenhorn, "That formula is no longer in place, so that'll never happen again. We're aware of that. It was a difficult time 4 years ago. Whether or not they continue to pay the $80,000 a year, we'll check up on it. Thank you for bringing it up, and we will check it out, that $80,000. It's an interesting point. So I hope that it's not been forgotten. I hope that the point is being addressed. Because if it is, I think you'll find that THS owes this community close to $500,000 for the payment, the yearly payment of that $80,000 that's not been made. So I wonder what kind of effect that's going to have.
Well, Steve, I don't want to get into a debate with you, but what was owed to the community is money that we're trying to find to buy medical equipment, and that's what the $80,000 is for.
I understand that. I understand. What I am interested in is past financial and management performance. The hospital is in a sorry state of affairs. That's not Cindy Bradley's fault. That's not Steve Rozenboom's fault. It is the fault of management over a period of time. Chronic bad management and chronic bad oversight over a period of time. And your proposal for a mill levy is astonishingly premature until determinations have been made as to the quality of that management and that oversight, I say. And I'm going to read the, well, no, I won't read the.
Mr. Chairman, if I could interrupt, Commissioners, has Mr. Malone, did you address this issue to see the status of that 770,000 that's reflected in the minutes? Was that the 80,000 for the next 10 years?
Commissioner, I have done my own analysis, and I have talked to two of the three lawyers involved. I have not yet been able to talk to the third lawyer involved, and be happy to give you my analysis, which is in bottom line terms that Mr. Hall is incorrect. I wasn't prepared to make a presentation, so I don't have the materials. Two of the three lawyers agree with my analysis, and the last one is pending. And so I'd really like to defer making a formal report till I have that in. That person was on vacation, and I'm sure by the next meeting I can make a formal report.
All right, thank you. And then, Mr. Archuleta, have we received all the minutes from Holy Cross Hospital as we've requested in the past two meetings?
Mr. Chairman, Commissioner O'Donnell, no, we have not received the minutes. We have received all of the past audit reports that were handed to me this morning, and so we will make those available to the commission.
All right, and again, could we please ask someone to provide the minutes to the county clerk's office?
I find Mr. Malone's comments interesting in as much as, and I'll be interested in the explanation, in as much as this board in February of 2011 voted 5-0 to accept that prepayment of $770,000 with the stipulation, the clear stipulation, that it would only be accepted upon continued yearly payment of the $80,000. So I'm going to be interested to see how that is explained.
Mr. Malone?
And I just want to be very clear on the record that I think that is not a correct reading of the documents.
No.
So stay tuned, Stevens. You know, it's going to come up on another agenda. You can show up then and listen to the explanation.
Mr. Chairman, if I could please, can we at least agree that we're in the right direction? I think what Ms. Bradley and what Mr. Rozenboom are doing is putting us in the right direction. And I, you know, instead of always trying to find all the negatives and everything that's horrible, can we look outside and see the sunshine and see that today's a new day, and I think we're headed in the right direction?
Right, and that's always where I'm looking, Commissioner. But I also believe it's...
And I agree. I hear that in a lot of your stuff, but I mean, quite frankly, they've busted their butts and they're doing what they can, and it being overshadowed.
Right, the folks now. But
all the people. Ana Beta's been there for 80% of her life. Don't tell me that she hasn't done what she can for this community.
I'm not picking on particular individuals. Nobody wants to see that hospital succeed more than I do. Nobody wants to see this community receive the good quality health care that it deserves, that all communities deserve.
I owe that hospital my life. 10 years ago, I was almost not here. That hospital put me back together. Thank you.
And I'm not disputing anybody's individual cases, what happened to you or anybody else. I'm talking about generally good quality health care. And I don't believe in the past that the management was such that that gave this community what it deserved.
Agree, but we're in the right direction. And you know what? I just want to hear at one of these meetings something positive. I'm begging this community to hear something positive.
With respect to the payments for Medicare and Medicaid, there have been studies by CBO, I believe it was CBO, beginning in the early 2000s. This declining revenue from Medicaid and Medicare has been studied and has been talked about. So this has been in the works for some years. Why wasn't this talked about, 4, 5, 6 years ago when these studies first came out? When it was said, you watch out for your declining revenues. That's the kind of management and financial oversight that I believe was deficient at that point in time. And again, I'm going to keep pointing these out, Mr. Fambro, but Mr. Rozenboom talked about the need for a new information technology platform. It was said today and at the healthcare advisory meeting that those costs would be in the neighborhood of upwards of $10 million, and that didn't include all the cost. That was just for software. Wasn't for, I believe, installation or training, those kinds of things. That system was installed, the one that's there presently was installed when the hospital was built in 1994, so it's 21 years old. Again, these are the kinds of management decisions, financial decisions that should have been addressed over time. The hospital shouldn't be in that position of having to be so precariously positioned with respect to IT services. Ms. Bradley talked at that meeting, and last Wednesday, the Community Healthcare Advisory meeting, and the Chief Medical Officer, I believe that's his title, spoke also on the same topic, the topic being primary care at the 28 February board meeting. That's where this community and all communities should be looking, the provision of good primary care. How do you get those primary care providers here? Ms. Bradley spoke of having difficulty finding a primary care physician for her own mother back in Norman, Oklahoma. And despite my very real disagreements with Ms. Bradley, I wish her well when she returns to Norman. I wish her mother well. I hope that she's in good health. And I hope that when you go back there, that you will devote some of your time to looking for ways in which Norman can also achieve better quality of primary care, just as this community needs to do so. I don't think profit centers are the answer, given the mix of payers in this community. The larger problem, the problem at the very base is the fact that this is a poor community that relies on Medicaid and Medicare. And until you deal with that question, the notion of profit centers is a foolish notion, I say. And I still say that before a mill levy is passed, that this body, which hasn't exercised the oversight that it should have, needs to look carefully at how that hospital was managed over the past dozen years or so. And I look forward to the explanation of the explaining away of the $80,000 a year requirement. Thank you.
Thank you.
Mr. Chairman, Commissioners, I would just like to make a comment that I respect the right to free speech for everyone, and it sharpens our, hones in our, it's like a knife. We may not disagree with, we may not agree with the right to free speech and what people say, but I'm a strong believer in that. And again, if I can't even get the salary of the CEO, something's not right.
Ms. Bradley.
I want to respond to your request for minutes. And I do recall it 2 meetings ago. I don't recall it being discussed at the last meeting because we were so focused on the Penasco Clinic. Our board bylaws don't allow the minutes to leave the building. And so people from the community are welcome to come and read the minutes. But the board bylaws have a very specific clause that talks about it. And so I'm not able to supply minutes to the county commission to place on your website. So having said that.
Well, that's the first I'd heard of that. I hadn't really looked into it. That's an interesting provision in the bylaws. And I guess the board will have to consider all of its transparency issues going forward. How about if we go in there and make copies? Or take pictures with the iPhone and then, no. All right, well, thank you for that. And I guess it's time we move on to the next item on the agenda, which is a presentation from Mr. Apodaca, giving us a legislative summary. Thank you all for attending from the hospital. So what did you do with all of the capital outlays, Mr. Apodaca?
Mr. Chair, members of the commission, everybody up in Santa Fe keeps telling me that it's in the mail, so I'm not sure what that means. But, Mr. Chair, I have some handouts that I want to just get through real quickly here. Mr. Chair, members of the commission, thanks for having me here today. I spoke to Mr. Archuleta, and I let him know I wanted to give you guys a brief overview of the legislative session. The Governor Martinez still has until Friday to sign any bills that are on her desk. So today what I want to do is just kind of go over some of the highlights of the last legislative session, then answer any questions, and if I don't have the answers, I'll get back to you if that's okay. Mr. Chair, so some of the big items that you guys are aware of that have been in the paper for a number of weeks right now, the two biggest aspects is House Bill 2. House Bill 2 is the budget bill for the state of New Mexico that funds state governments, the colleges, universities, education, and whatnot. That's currently on the desk of the governor. She has until Friday to make any. She can do some line item vetoes, or just sign all of it. It's about a $6.2 billion budget that's on her desk right now. So by the end of the week, we should know the outcome of that, of House Bill 2 and the budget for the state of New Mexico. The other big item that most of New Mexico has been kind of concerned about, or has had its has been kind of keeping a close watch on, was the Senate Bill 519, which was sponsored by Senator Carlos Cisneros. That's what most people refer to as the traditional capital outlay bill, or the severance tax bond. As most of you guys are probably already aware of, that Senate Bill 519 did not pass. It passed from the Senate to the House. The House made a number of additions and deletions to the original capital bill that never made its way. Basically within the last 10 minutes of the legislative process being finalized, the House finally passed it out of the chambers, sent it over to the Senate. Senate saying they didn't have enough time to look at it, but there were some major priorities that were differences between what the Senate members and the governor and the Republican House majority. They're still very far off on what some of those priorities look like. Just a brief overview. With the $12.7 million that was included for the Abeta water settlement, that would have brought Taos County as a whole county, with some of the other political subdivisions, of getting approximately about $14 million in the capital outlay bill. But that does include that $12.7 million for the Abeta water settlement. Some of the potential ramifications, if the 12.7 doesn't pass, well, that was this 12.7 would be leveraging about $130 million worth of federal funds. So I guess we have to just wait to see if there's going to be a special session, what's going to happen. Right now, the rumors are that, there's been some discussions on the on the outside, but they're still very far off, so who knows if there's going to be a special session at this point.
So Robert, over and above the Abeta money, there was 1.3 million. How does that compare to last year? I mean, we can't really compare with that 12.
Yeah, Mr. Chair, members of the commission, it's kind of apples and oranges because last year there was also a general obligation bond package that included a lot of different senior centers. I think UNM-Taos got some projects, but I can get that information to kind of see where it stands if you'd like.
Okay, thank you.
Mr. Chair, Senate Bill 112 that was sponsored by Senator Carlos Cisneros and also had duplicate bill with Representative Bobby Gonzalez that also passed. So it passed both houses. It's also awaiting action from the governor right now. That's the bill that defined agriculture use for property tax. It basically expanded the definition of the agricultural use based off of the way that some of the assessments were being made to the agricultural use on some of the properties within Taos County and some of the other counties. So that bill did pass. We should know by the end of the week if that's going to be signed or not.
Mr. Chairman, Commissioners, I just wanted to point out the 3-year you've indicated, that's the current law. The new law, and I have the bill if anybody wants to look at it, is based on drought. And if there's a continual drought, the ag land stays in ag land even if it's not being used. So I just want to clarify with you that if we continue to have drought, moderate drought in any portion of a county in New Mexico, then it's could be extended indefinitely if the drought continues. So.
Mr. Chair, Commissioner O'Donnell, yeah, you are correct.
Okay, thank you.
House Bill 441, Mr. Chair, the sale of the Taos Ski Valley bond sales, that did pass also. Also awaiting action from the governor. Again, that legislative authorization provided for the village of the Taos Ski Valley to issue the taxes, issue bonds up to $44 million for some tax exempt bonds for the Taos Ski Valley. So I believe the commission has passed some ordinances and have ongoing discussions with the Taos Ski Valley, but that's also awaiting signature from the governor. Senate Bill 117, which is the safety net care pool. You had a lot of discussion with the hospital a few minutes ago. That bill did not pass the House. That was a bill that was going to amend the Hospital and County Health Act to add January 1st, 2019 as a sunset requirement. Right now, the legislation speaks to that the current law requires dedication of the tax from January 1 until perpetuity. So this legislation would have put a sunset clause of 2019. From everything that I'm hearing is that the governor had basically asked the House to not let that bill go through for whatever reason. So, so that did not pass. House Bill 67, an amendment by Representative Trujillo, but carried by Representative Strickler. That also passed, and that bill amended sections of the statutes to expand the grounds for which property owners may request change to a property tax schedule. That was signed by the governor, I believe, yesterday. Senate Bill 104, that was carried by Senator Scherer, delinquent property tax payments. That was also passed or signed into law yesterday by Governor Martinez. That also amended the statutes to allow TRD to authorize county treasurers to act as agents for accepting delinquent payments for taxes, penalties, interest, and so on and so forth. So that was signed into law yesterday. Mr. Chair, some other pieces of legislation I just kind of want to just highlight to you. The bills that I just went over were some of the priority bills that the Association of Counties were interested in, along with Taos County. Taos County was, also specifically interested in the Senate Bill 112 and then the House Bill 441. But some of the other pertinent legislation that was being followed by myself, by the county, and with the association was Senate Memorial Number 6, a study of federal land management. That bill also did not move anywhere, but the legislation requested that Department of Finance and Administration convene stakeholders from different entities to look at the framework of transferring, federal lands to state lands, but that did not make it out of the Senate. House Bill 63, House Bill 386, both those bills were passed or sponsored by Representative Lundstrom. The House Bill 63 was the New Mexico Finance Authority Public Project Revolving Loan Funds. That's one that allows local governments to get loans or gets authorization for loans from the New Mexico Finance Authority. That did pass. Is also waiting for signature from the governor. House Bill 386, the Local Government Planning Fund, that also appropriated $3 million through the New Mexico Finance Authority from the Public Project Revolving Loan Fund for the purpose of funding local government planning for water, infrastructure, development, and water conservation plans, long-term master plans, energy plans, and so on and so forth. So there will be an additional $3 million available in that funds for any of your political subdivisions or any of your, if you have any mutual domestics that need planning money, master plans, comprehensive plans, that's available for some of your local communities. House Bill 578 by Representative Azell, that also passed, and that basically makes loans or grants from the New Mexico Finance Authority to some of the projects from the Water Trust Board. I thought I had seen a project in there for an entity in Taos County, but I'll double check and I'll get back with you on that, Mr. Chair. A couple other interesting pieces of legislation just wanted to bring to your attention. House Bill 366, that was sponsored by Representative Gentry, who's the House majority floor leader right now. There were a number of bills that we were with the association were fighting. Oil and gas, probably introduced about 4 or 5 for oil and gas preemption, which basically the bills at the end of the day said, whether you're a local government, if you're a city or you're a county, if you adopt a resolution or ordinance that the oil and gas industry does not like, these bills would have allowed them to just basically preempt any of those local government laws or ordinances and basically just do whatever they felt they needed to do to potentially expand.
Well, Mr. Chairman, Commissioners, under this bill, basically it would take all the power away from the local government.
Exactly, and Mr. Chair, so these bills were making it pretty easily through the House of Representatives, so they got stalled or stopped on the Senate side, but we'll continue to see more and more of these bills over the next couple of years at least. And again, Mr. Chair, members of the Commission, again, the hold harmless bills that we've all been kind of keeping our eye on. There were a number of pieces of legislation that were introduced. Senator Smith had one bill, Representative Harper, Senator Neville, they all did different things, but basically what that did is they would take away the hold harmless payments to local governments. It would increase the food tax. In some cases, some of the bills also allowed for tax credits for working families, but it's a very complicated. There's some very complicated bills out there. I think we'll keep seeing these bills over the next few years until there's some agreement on how we're going to deal with these issues. Senator Smith's bill, which probably had the most momentum, the governor's office did not like it because it would increase taxes to food again, and the governor did not want to see an increase as long as she's in there. It's kind of difficult to say, but I think we're going to probably continue to see these types of bills introduced until, if they can come to a compromise. I don't think the executive will want to pass anything that has any tax increases, but if they find some other ways around it, we may see something like this, pass in the next couple of years. So, Mr. Chair, Steve, I'm not sure if you have any comments. It's a pretty interesting session. I've been involved in legislative session for a number of years. Just some of the pieces of legislation that are being thrown out there or that are being passed, the dynamics are totally different. I think we need to work closer with the Association of Counties and even with the municipal league at times just to make sure that we're proactive, to make sure that the local governments, Taos County and your surrounding districts are proactive on some of the legislation that is going to be good for the county moving forward. So, Mr. Chair, if you have any questions, I'm more than happy to answer them.
Commissioners, Commissioner O'Donnell?
Mr. Chairman, Commissioners, thank you. I just wanted to say that in the capital outlay bill that failed, there was $1.5 million for the Penasco area for a new Department of Transportation road yard. So I'm hoping the governor calls a special session because I think that reflects the biggest amount, the $1.5 million for Penasco, and would help the area building a new road yard for DOT.
Yes.
Well, thank you for the presentation, Robert. Hope the governor finds her pen and that the legislators can get that capital severance bond passed. And I think a lot of bad bills failed, so that was good.
Yeah, it was interesting. Thank you, Mr. Chair.
Thank you. Next, we have a presentation from Anita Padilla on the CDBG project, Abregadero Road.
Mr. Chairman, could we have a 5-minute recess? I need some clean
Second.
air.
Sounds good. Call for the vote.
Yes.
Yes. Yes.
Yes.
Yes. We have a motion to come back into session.
Second.
Call for the vote.
We can get you a different number if you want.
Yes.
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 Yes. Okay, Anita Padilla, presentation on CDBG.
Good morning.
Thank you.
Good morning, thank you.
How is everybody? Good?
Very.
Temperature's okay? Richard was just asking me, so. Good, Richard. You have before you bid documents for the CDBG project in Cerro, New Mexico, otherwise known as Abregadero Road. This is the first time that these documents come before you. DFA is now asking that county commissioners sign off on the project, which you've done so previously before we have pre-bid conference or even the submittal of the bids. So these are our bid documents. Let me just note for the public that this package was way too big to be able to put on the screens. So if anybody would like a copy of this packet, they are welcome to either get them from Elsa, the purchasing agent, or myself. So you have the actual bid documents in front of you that gives the contractors instructions on the documents that they have to submit. You have engineering plans that show the aprons that everybody was concerned about. Earl and the engineer have been in contact. There were 2 aprons that were discovered that were not on the documents, so those were revised. And let's see, what else can I tell you? We have a pre-bid conference scheduled for April 9th. So all interested contractors are to be here April 9th at 10 a.m. in the assessor's conference room. We will go over the documents and the plans. If there are any questions at that time, they will be answered. Our submittal of bid documents is April 23rd at 3 p.m. And we will also open documents that day. I stand for questions.
Mr. Chairman, so Anita, pretty much it's a 24-foot wide roadway?
Mr. Chairman, Commissioner, yes, it is. We had to kind of narrow the roadway from what it is at this point to be within budget.
Okay, but there will still be gravel ends
Correct.
for drainage and all
Yes.
that good stuff?
Yes, sir.
And then as far as the thickness of the chip seal, there's a certain area that it says a 2-inch thickness,
Correct.
and then another portion that's 3.56?
Correct. Mr. Chairman, Commissioner Romero, what happened was when we were trying to get within budget, the existing roadway that is gravelled is going to be 3.56. The existing chip seal is already at 2.5, so we just need to add a little bit so it'll be the same amount as the other one. And that did cut down a little on our budget also.
And then I do see where it doesn't include the new driveway aprons, just for the public's benefit. What is a driveway benefit? Apron.
Mr. Chairman, Commissioner Romero, that apron protects their existing driveway. It also protects our new road, so we don't have a fall off.
And most of them usually include a culvert also for drainage?
If there are existing culverts, yes, we do not have budget for culverts in this project.
Okay.
Mr. Chairman, Commissioners, Anita, I just want to make sure this is a pavement and not a chip seal project.
Mr. Commissioner, County Manager Archuleta, yes, it is. It is a asphalt project.
And
with asphalt being overlaid on the chip seal.
do you want to brief the commission also on we have sold the bonds and DFA has gotten back the project to Taos County?
Yes, sir. There's a lot of people that don't understand the type of paperwork that goes into these projects. When we hire an engineer, all of the documents have to go back to DFA. Sometimes there's a lull there. It took us almost 3 months to get back a concurrence on that. We did have a meeting. Mr. Chairman was there. We thought we weren't going to get concurrence on our bid documents until next month. As you see, we're a month ahead of schedule, thanks to DFA. Bonds have been sold, and we're ready to go.
Mr. Chairman, I know the work behind the CDBG project, and you helped me with one in the past, and it's basically a nightmare. But we will be finished with this year, so we can start it all over again next year.
Mr. Chairman, members of the commission, yes, sir. I'm hoping to have a contract before you, either the first or second meeting in May. The total amount of days for the contractor, from what I'm being told by a prospective contractor, it'll take no more than a week to finish the project.
Wow.
So this should be completed by the end of fiscal year.
Somewhere in June.
Yes, sir.
And the deadline for next year's application?
I believe that's in December, sir.
December of 2015, and so if we complete the road project, we'll be in plenty of time to make that application. And
Yes, sir.
Perfect.
sounds great. What's the length and the width and the cost again, real quick?
The length is 1.96. The width is 24. And our maximum allowable construction cost at this time is $507,000.
So you'll go as far as you can.
We will,
Okay, great.
The end, right?
to the end and beyond.
What else do you want?
I wanted to
It
see,
sounded like-
I know that Ms. Padilla, I had asked just a minute ago about the possibility of having some speed humps in some of the more heavily residential area, and that's probably more towards the northern part of the road, closer to Lower Buena Vista. So I will be here. I will try and make it on Thursday to talk with the engineer as well and see if there's something that can be done.
And Mr. Chairman, we did have that conversation, and as I conveyed to Commissioner Gallegos, the budget on this is so tight right now, I mean, with us having to give and take with the engineer, that unless we put in a bid alternate, the speed humps cannot be paid for out of the grant. It is in the scope of work, so if for some reason a contractor comes in and says, you know what, I can do all of it, speed humps and everything for $507,000, that is already approved by DFA.
Mr. Chairman, Commissioners, on the back of this bid document, I appreciate you have the pay scales, is that correct? The last 3 pages of the bid document. These are all Davis-Bacon wages, is that correct?
Mr. Chairman, Commissioner O'Donnell, those are not only Davis-Bacon, those are state wage rates. These are federal funds. So in order to abide by statute and federal law, we have to put those in the packets so the contractor is aware of what he has to pay his people.
And then the fringes, what does that mean? Just 44 cents on the side, that's
something that the contractor puts in himself.
So they have to abide by these wages?
Yes, they do.
Is that correct? Okay, thank you.
Mr. Chairman, Commissioner O'Donnell, as the project starts and is in progress, I go out and interview any employee by the contractor or subcontractor to verify that these are the wages that they are being paid. So the certification of payroll is set to a higher standard in this type of funding.
Mr. Chairman, what's our community project associated with this? You know, like you got to do a little something, community awareness, or you have to do, well, that's just one of the classifications. CDBG, you have to do, you know, we did a project in the schools in Cuesta when we did Abregadero Road, that part. Is that something that we, yeah, affordable housing presentation?
Correct. Mr. Chairman, members of the commission, we do have to do something that has to do with the affordable housing. Last year, I went to a football game here and passed out affordable housing leaflets.
Yeah, so I just want people to know what the behind the scenes things that you really have to do to pull off a CDBG is pretty remarkable. Thank you for your time.
You're welcome.
And there's income requirements too. The project has to be in an area that serves a certain percentage of lower income people, right?
Correct, Mr. Chairman, that low to moderate income percentage rate for that area was 50%, and I believe we got it down to 41.
Right.
So we totally met the LMI on that.
All right. Do you have are you continuing on a presentation?
No,
That's
I'm
it? You're
standing
done?
for questions.
All right.
Mr. Chairman, Commissioners, how many people are bidding, companies are bidding on this project?
Mr. Chairman, Commissioner O'Donnell, we don't know at this time.
Okay.
It was published in the Taos News, the Albuquerque Journal, and the Rio Grande Sun. It was published last Thursday, the 2nd. At this time, I believe we have only one interested bidder that has picked up a packet.
Do you, Mr. Chairman, make a special effort to try to get contractors from the Taos area?
Mr. Chairman, Commissioner Romero, that's the only one that has come to pick up a packet.
Thank you, Anita.
Thank you. Have a good day.
Okay.
Mr. Chairman, Commissioners.
Oh, yeah, wait a second. We got to vote, right?
Is it permissible
That was the whole point.
for the county to contact bidders to bid on the project? Is that permissible?
Mr. Chairman, Commissioner O'Donnell, I do have a bid list that I go through. My last CDBG project, we only had 3 bidders. One local, one from the Velarde area, one from the Albuquerque area.
Ms. Padilla, is Lovato Trucking from Mora, are they on your bid list?
No, ma'am, they are not, but I can sure contact them.
Would you please contact them? I'll look for their number, too.
I'll find it.
Okay, they're in Mora. Shannon Lovato and Michael Lovato.
Sure.
Thank you.
Thank
So,
you.
Commissioners, we need a motion to approve this project.
So moved.
Second.
Yes.
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 Yes. Next, we have Leandro Cordova, and he's going to tell us about the audit contract. Good morning.
Morning, Mr. Chairman, Commissioners. It's that time of year again that we must approve our audit contract. The state auditor gives us a deadline of May 1st for a county to turn in their IPA request. So I'm kind of a little bit ahead this year trying to get it done because our audit deadline has been moved forward. Counties are now due on November 1st instead of November 15th. And so because of that, I asked our auditor that we had currently had to give me a new proposal lowering the cost. So what you have before you today, a couple of the important things to note. Important dates, we want to begin our audit on June 15th, which is obviously a little bit early before the end of the year, but that allows us to get all the compliance stuff out of the way and get a good head start. And they should be complete by the deadline of November 1st. They have included our single audit provision in there, which is probably for the CDBG, since we no longer have our housing. And they did give us a multi-year proposal. And because this is a new price from last year, this proposal is under the $60,000 that the state auditor requires a formal process for. So because it's under $60,000, we can get this proposal and we can go ahead and procure it that way. As I mentioned, the actual amount is $59,500, including gross receipts tax. The total comes out to $63,665. Last year, we were just over $74,000. So we did get the cost down, primarily because they do not have to audit the housing authority this year, except for 1 month. So they will do 1 month of the balance sheet audit of the housing, and then the rest will just be for Taos County. They did quote us the cost of financial statement preparation, which with each year I'm doing more and more of, so that cost can go down even more than that, depending on how much I can actually give them on the financial statements. So I stand for any questions.
Commissioners?
Good choice.
Is that in the form of a motion, Commissioner Fambro?
Yes, it is. To approve.
I'll second.
Any discussion? If not, call for the vote.
Yes.
Yes. Yes.
Yes.
Yes.
Thank you.
Thank you, Mr. Cordova. Good job. Oh, Leandro, before you leave, real quick, it's a little bit off topic, but something that relates to the earlier presentation by the hospital. And I'm interested in a future meeting to get the numbers on how much it would cost per $100,000 of property to sell $5 million in bonds. Just some rough figures. And also with a consideration of the various exemptions that are in place under state law. So there's primary residence exemptions, and for ancianos, I'd like to know how it affects a broad cross-section of our population.
Sure, I'll look into
that question. Thank you so much.
Thank you.
Commissioners, off to item 10, resolutions and ordinances, and we have Edward Martinez, the Director of Solid Waste, to discuss solid waste management fees, and Abby Martinez.
Mr. Chairman, members of the Commission, Mr. Archuleta, Mr. Malone, before you is a resolution regarding our solid waste fees to propose an increase on it. Right now, from $100 a year to $120 at $60 in July and in January, and $60 in July, for a total of $120 for the year. Right now, we have 11,739 billable accounts. We're asking for this resolution increase. They have raised our tipping fees at the landfill, and in order to make budget and to be able to pay for these increases, at the landfill, we do need a resolution to increase our fees for our for our punch cards for our fees for the solid waste.
Mr. Chairman.
Yes, Commissioner Fambro.
Morning, Mr. Martinez. When was the last rate increase?
It was about 8-9 years ago, and we haven't had one since.
At the landfill board meeting, in that 9 years, the town has raised theirs. I think they told us last month twice in that
Twice,
period?
yes, sir. Yes.
And at a greater rate than what we're doing here now, if I recall.
Yes. I mean, the prices of everything's going up, tires to keep my, my vehicles in order to, I mean, everything's going up. Right now, we're lucky the fuel prices are down, but I mean, within time, they are going to increase. And with a $20 increase, it would, in the long run, it'll keep us running in the black. Right now, we've slipped a little into the red, so with this increase, would really help us run an operation.
I'll have actually a couple. Actually, what Taos County is credited for and putting into the landfill is actually decreasing at a pretty good rate. Is that not correct?
At our tipping fees?
No, what we're putting in the landfill, the actual trash, towers, everything, and that's because of your recycling program, and the other programs that you've instilled, which unfortunately cost a little bit of money, but no one else is going down, only Taos County. No one else is going down in what we put in that landfill other than Taos County.
I mean, and right now we are the lowest in the state of our that we charge for our refuse. All the other counties that I've contacted, they are, they're quite substantially more than us. Abby and I were in Española a couple months ago talking with their solid waste, and one of the commissioners mentioned, that Taos County is the lowest. I guess he's done his homework on it, and he says, you guys are really the lowest. And
they pay $20, $25 more than this, and they only have 8 punches, where we have more. We have 50% more punches than what they have, and they pay 25% more currently with this increase. Also, Mr. Cordova, if you could help me here, what is the amount that you've had to transfer from the general fund last year and previous years, if you know, from general fund to offset the deficit in the solid waste fund?
Last 2 years I've been here, we haven't had to transfer anything from general fund. This last December, we came before you and requested a temporary loan of $30,000 in order to meet cash flow. Later on in the meeting, I'm asking for a budget adjustment so you can see how much we're estimating we're going to be short on landfill tipping fees. It's about $28,000 we anticipate being short on tipping fees for the landfill.
And Mr. Cordova, this is an enterprise fund for Taos County, which means our fees are supposed to offset the services that we're giving to our citizens.
Yes, and when Edward mentions that we're in the black on operations, the county still supplements for things like equipment, fees, fines, anything along those lines. The county has been still supplementing, so we appreciate them being in the black, but this will give them the opportunity to also develop a plan for the future and replacement of equipment, and looking ahead so that they're not always asking the county at the last minute for something to replace a broken this or that.
And I know this is way cheaper than your solid waste fees, because that came out in the meeting in Rio Arriba. So I was just amazed that how much, not only is Taos County the lowest, but by how much. I mean, we're way lower.
I mean, with this increase, it would just make it $1.67 a month. I mean, a month more. We were at $8.33 before. It would go up to $10 now. So that's a difference of $1.67 a month more that would hit their pockets.
What happened 3 weeks ago at the end of Straight Arrow Road?
We found an illegal dumper there that we actually cited. We've found actually since then, we found a few more that we've actually given citations, and they have gone in and cleaned it up, but they did get a $500 citations, and they went and they picked it up.
They made them reload the stuff in his truck right there while they stood there. He came to our meeting late because he stood there until they picked up everything in the area, not just what they dumped, everything that was in the area. Your efforts are just phenomenal.
Thank you, sir. Yeah, and like I say, within that time, we caught 2 more in Arroyo Hondo, which we also went and made them pick up, like you say, the area, and plus, a little bit more around. So, I mean, we are generating a little bit more money on that. Also, with the tarping, we've actually gotten some citations, and people are starting to pay for their no tarping ordinance that we have.
And we have 2 cleanup days coming up on May 2nd that Mr. Martinez and his staff is participating fully on that Saturday. The 2, he's trying to tie them together so we get a bigger area together. Yeah, I know nobody wants to raise any fees or anything, and I sympathize. I've met with Mr. Thilke on his situation, and I appreciate it and everything, but you know what? I don't know how we can continue to stay ahead, Mr. Chairman, members of the community, without approving this increase.
Mr. Chairman, so how many individuals do we have that pay the $100 a year fee?
We have 7,392.
And what is your collection rate?
Right now, it is at 887,040. No, excuse me. It's at 739,200 at the $100 rate. At $120, it would go to 887,040 with an increase of 147,840.
But currently, as far as the percentage on collections, do you know what it is?
Commissioner Romero, what I did in January, the billing that went out, the girls and I have collected 66% of what was charged. We are in the red a lot with what is due still from all the previous years. That's probably about 600,000 still. But we're, on top of it, we're doing our collections as best as we can by calling, sending letters, putting liens. We have close to about 400,000, I think, in liens now.
So,
$400,000 in that we.
Mr. Chairman, Mr. Archuleta, how can we possibly collect that money? I know that a lot of these folks don't pay because they're protesting the amount that they have to pay, the $100 a year, $50 every 6 months. It may, in fact, grow that amount of non-payers once we institute a higher fee.
Mr. Chairman, Commissioners, Commissioner Romero, I think that Abby and Edward are doing an excellent job in trying to do that. Part of what we're doing is cleaning up and following through on the illegal dumping, as was just mentioned prior to this. So they're dumping their trash somewhere. And so we're trying to follow that and figure out where they're dumping their trash. The second item that we're doing is we're actually filing liens on their property. And so when they go to sell, they come in for another building permit or any of those things on their property, at that point, the lien needs to be paid up for their solid waste. And so I still know that there is a lot of individuals that go and dump at, just commercial trash cans or any of those things. And unfortunately, they're the ones that either, the commercial businesses are the ones that either have to put locks on those or try to, keep residents from doing that. But, it's just a fee that people have to pay just like anything else in the community to try to keep that trash in the landfill.
And how does it compare to an individual that is contracted with waste management? How much does waste management? We charge $120 or $100. It'll be $120, $10 a month. What does waste management charge for pickup?
Mr. Chair and Commissioner Romero, what they charge per month, I believe, is anywhere from $18 to $26 a month. But we have our $25 account customers, which is the Waste Management Disability Homeowners Association. Wayne Chavez is in there as well as a private hauler. They are excellent in paying. The $25 accounts they're high up there in the percentage.
Yeah.
On the $100 accounts, there's that handful, that 400,000 that I mentioned, where they're throwing their trash, we know, out in the arroyos. But it's not until now that we are actually enforcing the ordinance. And we're showing people that we are going to find them, and hopefully this is going to get them to come in and start paying what they owe. The liens that we do have out there, they're there until they either sell or they borrow money, they're going to have to pay it. The lien will never go away. It's there till they pay.
Mr. Chairman, Commissioner Romero, also one of the things in the discussion with Rio Arriba was our collection rate is way higher than theirs. I mean, they're just pretty much amazed on the stuff that we're pulling off. They're in the 40 something percentage in collection. So us at 67 is actually, we're doing, I mean, I wish there was a way that we could step it up and do a little bit better. We'll get Joaquin to bring his billing stuff that he does over at the EMS and bring it over here because he's very successful at that.
Yeah, because it's still $400,000.
Yeah.
That's out there.
Does the 67% include the liened property? Or is that just on the people that are paying?
That's just on the people that are paying.
So the 67% does not reflect the 400,000 in liens? And what's the collection rate on the liens?
Very low.
Right, or like zero?
Not,
No.
I would say maybe about,
Yeah.
it's within, yeah.
Or refi, anything.
Are the liens growing more than the collections? Are the liens growing more than the collections? In other words, is the $400,000 number getting bigger?
No, because I started, when I started putting the liens on the homes, I went. So we are getting people are coming in on 500 and less. They're coming in to pay that. Of course, they don't want to lien on anything like that. But we're looking at 1,200, 2,000 that they owe, and in a certain district, I can pinpoint it completely as to what district owes the most.
Mr. Chairman, I mean, now that we have our code enforcement, now that they know a number that they can call for illegal dumping, we have been getting quite more amount of calls coming in of people wanting to report illegal dumpers. So with that's how we were able to catch these other two in Arroyo Hondo. People, reported that said they'd seen the vehicles going in, and so that's how we were able to track them down. As Mr. Commissioner Romero knows, up in Llano, we need to set up a camera up there to catch people that are going up into the arroyo, and it being a watershed, it's the northern Rio Grande becoming a national monument, tourist attraction. We need to curb these illegal dumpings because it's really an awful sight to see out there. We did apply for these RAID grants to clean up these illegal dumps, so we're really hoping we get this grant so we can clean up some of these illegal dumps, and also to keep the refuse out of the landfill. We've been working with the schools, which we're starting to recycle more at schools. So, the schools, if everything ended up in the trash bins, now they're starting to recycle a lot more, and we're working with them, and it's we just started it, and it's just been going real good.
Yeah, I applaud all of your efforts. What's the projection on the how much this is going to raise per year? This proposed increase?
Between the $100 accounts and the $25, the increase would be per year $169,575.
Additional revenues to the enterprise fund per year?
Additional revenues at about 65% collection.
Oh, right.
Think about it that way. We probably won't collect all of that either.
So it's 100,000, approximately 100,000. And what do you project to spend that additional $100,000 in revenues on going forward?
Tipping fees, as Commissioner Fambro mentioned, our tipping fees are down in terms of actual tonnage to the landfill. That's what created the increase in the landfill fees in the first place. The less we dump in the landfill, the more they raise the rate. So here we are creating less waste and still being charged more. So the majority of that money will go toward landfill fees. We'd like to be able to give the staff of the public of solid waste a small raise. They haven't seen in 8 years, or the last
8 years, 9 years.
2 or 3 years on the raise, but that's something else we would do, and then we'd start putting money aside for capital improvements going forward, and to be able to replace equipment, work on his transfer sites on the outlying areas. We have a major transfer site project that's being proposed for our capital improvement plan fund in Chamizal that we just can't wait for them to make the money. We're gonna have to pay for it from the county's funds, and it's essential, but if we had an extra base of revenue to start putting some money aside, we could get there.
Mr. Chairman?
So what's the percentage of the 100 that goes into operating? So for raises and tipping fees, that gets you back to even on operating versus the percentage that'll go into a capital improvement fund? And then,
I would say at least 50%, but I can't give you that as a guarantee. We kind of have to see. What we've seen this year is actually, we started talking about this rate increase last May, knowing that tipping fees were going to go up. Edward's done such a good job, him and his staff, of lowering the amount of money, of tonnage going into that we've cut what probably would have been a bigger deficit down by just putting less tonnage into the landfill. So I can't tell you, if they continue those efforts and we continue to recycle, we may be able to use more of that money towards capital improvement and less towards operation.
Mr. Chairman, also, with some of that money, we could also purchase stuff for more recycling. That way, I'd really want to promote as much recycling as we can, because since I've taken over, I've noticed the decrease in tipping fees at the landfill, because we, started the recycling program at all the transfer stations. So, I believe the more we recycle, the, less goes to the tipping fee, to the landfill. And also we could generate some sort of, revenue by recycling and, then taking our own recycling to Albuquerque or Santa Fe to bring in some sort of revenue.
good. I think we have Commissioner Fambro and then Commissioner Romero.
Well, actually, he was still going slow.
So I just wanted to make the comment that why a lot of those, tipping fees for the county may be low is because a lot of that construction waste is not going to the landfill. It's ending up in arroyos and
yes, sir,
riverbeds and elsewhere.
And those are the ones that we can't.
Or people are just burying it.
See where it came from, like the illegal dumping. A lot of people leave their personal information, so we've been able. That's how we were able to apprehend these individuals and make find them, cite them, and have them go pick up their piles of trash that they've left behind.
And the decrease that we've seen in construction over the past 5 or 6 years hasn't helped either. So if there's some pickup in the economy, that's going to make another positive difference going forward for the enterprise. We've got lots of prospective comments here. So I guess I'll start with Commissioner Fambro. And
was Miss Commissioner, you were? Okay. And also there's a new cell that's, the bid on the new cell that's going to be opening is going to be awarded next Tuesday. And we're currently at a deficit in that. And I don't know how much of this in the future we may have to look at that, but last month we approved a loan from the town of Taos in order to get the bid going so that there would be the money in the budget to start the project. But the other side of that now, our road department is getting very good pit run at an extremely low price. So I mean, we're kind of getting some money back in savings and stuff in what we're doing on this. So there's just a lot happening on that, and we need to be.
Mr. Chairman, Commissioners, I just wanted to answer Commissioner Romero's concern. Waste management at the low end would be $216 a year compared to our 100 or 120 raise. On the high end for waste management at the $25 rate per month would be $300.
Okay, thank you.
Thank you for that. Bob?
Just very quickly, I just want to be sure the commission is aware of the effective dates of these proposed rate increases. Because of the billing cycle, the $120 fee, the full fee, would be effective July 1. Because of the one-year billing cycle on the discounted fees, that would not be effective until January 1 of next year.
Bob?
Mr. Chairman.
Commissioner O'Donnell?
Mr. Chairman, Commissioners, how much have you collected in fines thus far?
Right now in fines, we got our citation forms probably about a month and a half ago. I believe we've collected probably $2,000.
And what would be your projected fine collection for dumping, illegal dumping?
For the year?
For the year.
It varies on how many individuals we're able to find, apprehend their personal information. I know on Straight Arrow there's probably 10 different individuals that have been dumping there. So like we're proposing that if we get this grant to clean it up, we are going to be sending them letters and be giving them calls saying, we have found your stuff, And what we've done is the fine's $1,000, but the 500, we've been charging $500 and they've gone and picked it up. So that, after speaking with the judges, with Judge Shannon, it was like, well, you guys have that option of either giving them a $500 fine and having them pick it up. If they don't pick it up, then, go ahead and charge them the whole $1,000.
Commissioner O'Donnell, this is really the first attempt at getting real aggressive on this, so it's kind of hard to put, we talked about this. I guess after probably in September, we maybe can give you like a 6-month history and kind of go on that. And what our hope is that there will be none, because the more effective he is in his citations, the less illegal dumping, which is our goal. So
right,
that's not going to be a true revenue stream. We're using that as a deterrent more.
Yeah, Mr. Chairman, because also members of the commission, because also some of these citations are for no tarping. So we have at our transfer stations, even at the landfill, a $40 fine for an untarped load, which we do have signs all over the county roads at all our transfer stations, even going into the landfill. So people are starting to tarp, before we started this tarping order, that we enforced it, it was probably a 2% people being tarped to where it's gone up to probably at least an 80%, 85%. So now people are being more aware that they've got to tarp their loads. They can't go to the transfer stations without their loads tarped, or they will get cited. Even at the landfill, they're turning them away if they don't have the towns out the landfill. They don't cite them. I don't know if they don't have a code enforcement that's not, but they'll call us and we'll Lorenzo will go over there and he'll start citing these individuals that are untarped.
So, Mr. Chairman, Commissioners, do we have a new grant writer coming on board, Mr. Archuleta?
Yes, we do.
And when is that person coming on board?
That person actually came on board yesterday, and we're in the process of sending her a bunch of applications. In fact, over the weekend, I believe Edward and I and her had some email exchanges on some recycling
rate
grants that Edward had put in for that she's also going to be following for us.
And my follow-up to that is, unfortunately, we missed the Clean and Beautiful grant application deadline because of the CDBG documents that were being prepared. Is that something that we could funnel into solid waste? Do you have any idea what those grants are for Clean and Beautiful?
I don't, right off the top of my head, it's something that we could definitely look into. I don't know if Mr. Martinez, who follows those grants a little closer than I do, would have some
Could we find out when the next funding cycle is and see if we could fund that?
But we did get an application in on the RAID grant, and that's for tires, illegal dumping, and recycling. So we did get that in.
Yeah, because there is a $900,000 out there, $600,000 for the illegal dumping of tires, and $300,000 for recycling and illegal dumping, which we did submit some, I did get some quotes to get some of these places cleaned up. I did get quotes on bins for the county complex, for the courthouse here, and for the schools. So, I'm hoping that we do get these grants. I had a lot of letters of support from County Manager, Commissioner Fambro, BLM, Forest Service, the Landfill Board. So I did get a number of letters of support. The town of Taos Mayor Baroni, which is a big help in acquiring these grants. The more letters of support stating that the county and town of Taos is working together on recycling and illegal dumping, the better chances we have of getting these grants.
And then, Mr. Chairman, Commissioners, Mr. Archuleta, can we use PILT money to fund solid waste?
We can't use PILT money to fund ongoing. If we wanted to do a one-time purchase for solid waste, say we wanted to buy recycled containers, those kind of things, we could, but it's not something that we would use for employment for people, ongoing expense days, because it's not an ongoing revenue stream.
Could we buy new trucks for them? Is that what you're saying?
We could, if that's the choice of the commission, to use some of that PILT money for that.
Commissioner, this year the capital improvement plan will be funded by PILT, and probably will fund a transfer station in Chamizal renovations, which is probably about $100,000 on our estimate. So we will likely put more money into solid waste from PILT.
And then, Mr. Chairman, Commissioners, you had mentioned that this increase would go towards wage increases, but don't we already have factored in across the board possible wage increase for all employees? So I just wanted to clarify that, because he said you could take that money and increase wages, but I thought we had a possible plan. We might pass on across the board wage increases for everyone.
Commissioner, if we do pass across the board, then we'll just be in a bigger deficit with solid waste, which will require general fund to supplement that. So if we did pass that, which would be great and everyone deserves it, it only creates a bigger hole that they're in if we don't raise the rates. If we raise the rates, we're made whole and we're able to continue to operate at a profit again.
And Mr. Chairman, Mr. Cordova, I appreciate that, but isn't it true we may have an extra $500,000 we didn't anticipate for our budget next year? What I'm leading up to is we could fund this solid waste through other means other than an increase.
Commissioner, I'm not aware of an extra $500,000 anywhere. In preparing our budget this year, we're getting really close to maybe being balanced for the first time in 3 years, but we're nowhere near having a surplus that I can determine. You know, we had a $2.2 million unbalanced budget last year. I mean, $1.8 million last year, 2.2 the previous year. We're coming to a zero this year, but I don't foresee a surplus anytime soon, maybe not for another year or two. So I don't know where that surplus.
But we could fund this out of the general fund budget if we had to.
It would probably create a bigger deficit than we're currently in, but if we had to, I mean, we would have to probably get permission from DFA to continue to operate in a negative, because we are not able to continue to operate in a negative much longer without them taking over our budget process.
Mr. Cordova, could you give me a quick definition of an enterprise fund?
An enterprise fund is basically a business. It runs itself. It's supposed to be self-sufficient. It creates revenue, and it's supposed to cover its own operating costs, including all capital expenses in the future. Enterprise fund, like our EMS and solid waste, are the only two we have. The town has utilities, and those are other examples of enterprise funds.
So, Mr. Chairman, I'm sorry, one more. Could we not, we've been talking about a ban on plastics and also a ban on paper bags, and understand the city of Santa Fe is possibly going to enact a 10-cent charge on paper bags, where the grocery stores would get 1 cent, the city would get, or the county would get 9 cents. I'm just trying to think of other ways to generate revenue for this solid waste department. And at some point, I mean, this could be, I'm just saying, could this be a possibility that if we enacted a ban on plastic bags and paper bags and put in motion fees for people using paper bags, that we could funnel that money into the enterprise fund?
Mr. Chairman, I mean, I would welcome any revenue enhancement at all, because I only see our problems getting worse in the future. We're not going to cut operational costs. The cost of illegal dumping is only going to go up, and the tipping fees are only going to go up. So any revenue enhancement I welcome entirely, but I don't think it's going to get the county off the hook. In other words, the fees for service need to cover the service. Or if we could collect at 80%, we probably wouldn't have to raise fees on people. If more people were paying their fair share, we would all have the ability to keep the rate lower. But that isn't the case either, and therefore it's kind of economics. You know, you got to cover operations one way or another. But any revenue enhancement, I'm open for, and I will explore it if you give me the direction.
Please.
Commissioner Gallegos.
Real quick, Mr. Chair. Martinez, what rate or average on a resident that hasn't paid, how much of it is actually penalties and what is the actual monthly or annual payment that they're supposed to make? So they pay $120 or $100 a year. You know, after the 1 year that they don't pay it, what's the penalty? And I guess I'm asking the commission, maybe think about considering that if there's 5,000 residents that aren't that haven't paid, or they got all these liens, that if you forgave the fee and had them pay just what would be the actual ones that are owed, that would be a little shot in the arm, and they get them to start paying right away, as opposed to you have right now somebody owes $4,000 or $5,000. The last thing they want to do is even come near the county because they don't want to pay anything. So if there was an opportunity to maybe give that forgiveness a one-time deal, not that we want to encourage all the other 66% that have been paying, faithfully to fall back, but it might be something that we may want to consider or give it, entertain down the road to do a little bit of homework on it. Maybe see if that's something that we can gain some of this revenue back that's being lost at that 400,000, because some of these residents are not moving. They're not going to sell their home. So out of that 5,000, you're looking at 25 or 3,000 people that are just going to say, well, just let it build up. I'm not going to sell my house. And if it doesn't, my grandkid or my kid's going to end up taking over that balance. So maybe we can kind of catch them halfway or something in that, because those fees do build up, and they just get worried about not wanting to pay the fee, and they may just pay the full amount. I don't know.
Mr. Chairman, Mr. Malone, can those fees be waived? Is it legal?
I would want to explore the anti-donation questions involved in waiving a fee. It's clear that disputed amounts can be compromised, and if they're disputed, that's not an issue. But if it's just forgiving something that's owed, there may be an anti-donation problem. But I can't give you a top-of-the-head answer, Commissioner.
And Commissioner Gallegos, are you
Sure,
done?
I'm fine.
Mr. Chairman, Abby, you had mentioned earlier that there were districts, and you could basically tell us which one is the most difficult to collect from. Is this District 3 one of them? Can you name those districts? How would they rate?
The worst district, I believe, is that 4?
Oh, 4.
5?
5?
5.
5.
Whoa.
Yeah.
That's where the most is at.
With that, I mean, I don't know how, Mr. Gallegos, it kind of wouldn't be fair for the ones that have paid their bill. Then they might just say, well, you know what, then we'll stop paying our bill and then we'll be forgiven.
Right.
So that kind of is a touchy little subject there, because for all the 7,000 that have paid, it's not fair for them to that they've been paying their bill and they've been paying it on time and they've been up to date, to forgive the ones that haven't paid. Right. That's what the question we ran into in Espanola, and sad to say, it was their commissioner, that one that was owed $6,000, and he's the one that really wanted to waive the bill, waive their bill to not pay. So once again, it kind of wouldn't be fair for the ones that are caught up and have paid their bills, as to the ones that haven't. And who's to say that you forgive them their bill and that they will pay? Once you bring it down to a certain deal, it's really not fair for the ones that are caught up.
Could we consider the other opportunity maybe then of, if a resident is at $2,500 and they want to pay in full, not get anything waived, retire that bill that they make payment plan, and they can start currently doing that. I think that might satisfy somebody else that may have those issues, that they don't, they understand that they got to pay all those penalties, but if it's going to continue to build up, sometimes they don't ever see the end of the light at the end of the tunnel, and they may be able to do this where they say, okay, well, I'll get back on the grid and I'll pay my $100 annually plus another $100 or $50 on top to kind of kill that one, so it doesn't keep adding on the fee.
Mr. Chairman, Commissioners, I think Commissioner Gallegos' idea initially is a great idea, and I have to disagree with you, because the state of New Mexico does a period where they waive if you're behind on your GRTs, and you can work with them and pay less of a fee. So they do, even the state has these grace periods so they can collect more money. And if we can accomplish collecting some money then I think Commissioner Gallegos' idea should be explored, and I hope Mr. Malone would check on the anti-donation, because this is a way to bring in more revenue. And my question is, if there's a lien, you said someone has a lien right now, I'm sure my district, $12,500. If the house sells, does that come off their real estate? How does that work?
I believe it comes out of the closing cost. So when it sells, it's added on as to what other expenditures they have that needs to be paid. So it does come out. We work hand in hand with the title companies, the banks. So whenever someone is refinancing, selling, we get that. We look it up. They owe money. They come, it's paid. One thing that I wanted to comment on, what Commissioner Gallegos was saying about, we do have a promissory note. So we do offer our customers a lesser amount to pay per month. We work with them totally. If they pay, say they owe $1,200 and they have penalties of $144, we will waive that penalty if they pay it in full. If they come in and sign a promissory note, we'll waive that penalty. But if they, fall through and not pay, that penalty is added back in. But let me tell you, not too many customers come in and want to do a promissory note. We offer that has been offered since I came on board, and they won't come and do it. We try to work as much as we can.
You can offer payment plans without interest accruing though, right?
Of course.
And
Currently,
you do that?
we're not doing penalties.
Right.
We are not charging any penalties. I mean, we would be really in the rears if we did.
Well, I'm all for stepped up efforts on trying to collect on the $400,000 worth of liens, which would maybe be a matter of systematically communicating with those people and making offers for payment schedules as the commissioners have suggested. I do think we have a more immediate financial situation here. We've got Stephen had something, and Commissioner Fambro.
Well, I was just going to say the $1.26 a month, if you do the $10 bag fee that was spoken about before, you've got to be really careful when you go grocery shopping, because that's in 12 bags, you've now paid more than what our fee increase is proposed.
Yeah, bring it on.
Mr. Chairman, Commissioners, first of all, I want to say that Edward and Abby have done a great job and actually are sort of the model in Taos County. We have a lot of counties calling us, asking us how we keep our fees down so low, how they do their collection, how they send out their cards or their punch cards. Waste Management has approached the county and has approached me on several occasions to move forward with privatizing. A lot of communities across the state of New Mexico have privatized their collection, and I'll tell you that Waste Management will not, if you don't pay your fees, you don't dump. They don't pick up your trash, and that trash ends up in the landfills. It ends up in not in the landfills, in the arroyos and other places. But if you look at that, even with their lowest fees at this point, we're still $100 underneath what Waste Management is saying, which is for profit. It costs them to actually pick up those fees. So we are doing a service, and Abby and Edward are doing a service to this community that's a model service that's remarkable. To just at this point get to $120 for them is remarkable compared to the $216 and $300, and also keeping it lower than any other county in the state of New Mexico. And so I understand the concerns of the commission and raising the rates on their constituents, but in reality, the alternative at some point would be that the county not do the trash pickup anymore and we turn it over to Waste Management, which would really hurt our constituents. Then we would really be hitting them in the pocketbooks. We're not talking $20, we're talking over $100 at the low end rate on our constituents, and I think that would be disastrous.
Mr. Chairman, I totally agree with what Mr. Archuleta has said just now, and I realize that it is a fee that we have to impose, and we need to try to collect more of those delinquent accounts. But I also realize the fact that we do have a constituency, especially in the outer areas of the county, that is on a fixed income. And we do have residents out there that are probably at the most bringing in $400-500 a month. And so we also have to realize that type of a constituency and figure out a way to work with them so that we can accommodate those needs as well. And it probably turns out that a lot of those older people produce even less trash than anyone else in the community. And so somehow we need to figure that in as well.
Is there anything that we can do on indigency cases? I don't know if that's ever been explored.
You can explore it.
I would like to see something like that.
Commissioner.
Mr. Chair, I have a motion to fee increase.
Second.
Discussion, Mr. Thilke?
We had a committee a while back that met.
I was going to bring this.
It was called the Solid Waste Task Force. Community members met for like 3 years, and we dealt with a lot of the issues. And we had a hostile consulate, a hostile commission at the time that never gave us, that never allowed us to get on the agenda. And Abby was around then. I don't know if she has saved what our suggestions were or what our proposals were, but we never got a hearing. And it wasted community members' time for 3 years, and we never got to deal with any of the issues. Thank you.
Mr. Chairman?
Yes,
Commissioners, I'm wondering if Commissioner Gallegos would amend his motion to include research into indigency problems and possibly, again, this vote that Mr. Malone was going to inquire whether we could waive some of these liens. If we, better to collect 40% than nothing, or, whatever. I'm just wondering if it's possible.
Mr. Chairman?
Yes, Bob.
Just very quickly, the form in which this proposal is made is dictated by our ordinance, which is a resolution, and it wouldn't fit in with the resolution.
Okay.
And I think implicit in the motion and the second is a concern that the department continues to do everything that it can. I mean, we certainly appreciate the turnaround, but trying to figure out ways of communicating with those people who have the $400,000 outstanding, looking into the possibility of giving relief to our least fortunate community members. I think that once we pass the increase, there'll be some flexibility there possibly that you can look into and bring back to us. But we do have the motion and the second on the table.
Further discussion, please. I was against this when I first talked to Mr. Martinez about it, and then I saw what they're actually doing and what he's trying to get done. And I was so impressed that he convinced me otherwise. It's very progressive, it's very aggressive, and I think we should support his efforts.
I think you do provide a good service at some of the lowest rates in the state, so we thank you for that. And Commissioners, is there additional discussion to be had, or shall we call for the vote? Please.
Yes.
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 No.
Yes. Thank you, Edward, and we'll look forward to future presentations on progress made. I did have one constituent tell me that he followed a waste management truck and the trash was blowing out of the top in between the tarp and the truck. And so you might want to talk to those guys about cranking it down a little bit.
He will. Thank you, Commissioners.
All right, thank you,
Y'all have a good
Edward.
day.
They're all over, yeah, all over.
So where are we on the agenda here? We are at the Tax Advisory Board.
Lodgers tax.
Lodgers Tax Advisory Board. Valerie Montoya.
Hello, Chairman, Commissioners. So I'm here before you to ask approval for the members of the Lodgers Tax Board. We are coming upon the proposals here in the next couple of weeks, and so I need some members to hear those proposals so I can bring those recommendations to you. First member I have is Richard Spera. Then I have Signe Nichols, Alvino Martinez, Della Baroni, and Jeanette Rael.
I make a motion, we accept them.
I'll second, Mr. Chairman.
Thank you.
Thank you. Is there any discussion from the board? If not, then we'll call for the vote.
Yes.
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 Yes, thank you, Valerie. That's a really good group there, and appreciate your bringing it to us. Now we have a discussion regarding the Citizen Advisory Committee. Jana is not here. Shall we?
Yes, she is.
Yes.
Oh, there she is.
Sitting in the back of the room.
Ortega.
Exciting.
Good afternoon by 1 minute.
Good afternoon. Good afternoon, Commissioners. We're looking to collaborate with community members and begin a Citizen Advisory Committee for the Detention Center. The Citizen Advisory Committee will consist of members and organizations from the community to work with the Detention Center to provide additional programs for detainees, including additional mental health and medical, and a continuity of care after detainees are released. I have Lawrence Medina with me. He's going to do a short presentation on the Citizen Advisory Committee, and then we'd like to hear from the Commission.
Good afternoon.
Good afternoon.
Chair and County Commissioners of Taos County. You know, back in 2012, we had the privilege of hosting the first annual Substance Abuse Summit in Taos County, and we had over 300 people in attendance at the Kachina Lodge. It was well supported, and there was a lot of discussions about the substance abuse problem that we're faced with in Taos County, and also the mental health. We see that the drugs and alcohol, how it's destroying our families and our community as a whole. So we came together to not just about pointing the finger, but as a committee and community members, we wanted to be part of the solution. And as a result, there was a report that came out, and therefore we formulated a committee called Recovery Friendly Taos County. We're a member of a national organization called Faces and Voices of Recovery. And in Taos County, we were the first in the state of New Mexico to formulate a recovery community organization, and that we're also connected at the national level. A lot of other counties are beginning to follow Taos in our work. We have some great other coalitions that we collaborate, Taos Alive Coalition being one, also the Taos County Crisis System of Care. You know, some of our partners, our mission is dedicated to promoting a recovery-friendly community through network development of supports, opportunities, access to services, education, and information. We are committed to reducing the barriers created by the stigma and replacing it with hope and wellness. And I want to thank Commissioner Candace O'Donnell for attending our meeting last year when we came up with the idea of the proposed Citizen Advisory Committee, and also County Manager Archuleta for his inputs, and of course, Jana Gonzalez for her openness to this proposed project. Committee entities that are behind Recovery Friendly Taos is, of course, Rio Grande Alcoholism Treatment Program, Tri-County, Taos Pueblo Behavioral Health, Taos Alive Coalition, Vista Grande High School, Vista Taos Renewal Center, Holy Cross Hospital, the Faith-Based Community, CYFD, Shadow Mountain Recovery. We have the Behavioral Health Service Division with the state of New Mexico. We have representations from consumers. We have Taos County back in 2012. The commissioners at that time provided us a proclamation regarding a recovery-friendly community, which we're grateful for the commissioners' support back then and now. We also have the district attorney, who is also part of this, Public Defender's Office, Taos County DWI, Community Against Violence, and just to show the representation on this. What we're proposing with the Citizen Advisory Committee is that nationally and even at the state level, it's best practice to have these type of advisory committee in efforts in the spirit of collaboration and not as an adversary. Based on the packet that was provided on page 2, in the spirit of collaboration, the proposed Citizen Advisory Committee will provide support to the following: support the mission and goals of the Taos County Detention Center, ongoing positive communication between the detention center and the community that is being fostered, public education and understanding related to community-based programming, awareness and consultation specific to pertinent community needs, concerns, and developments, engage in the planning and implementation of reform programs to help offenders from returning to crime back into the jail system, planning and development of systems of care related to substance abuse and mental health needs, support professional development through training of all detention centers and detention center staff, support public policies and adequate funding to the detention center, and last, participate in the detention center's strategic planning process. I just want to acknowledge some of the members that are here for support. We have Gloria Robert Shaw with Rio Grande, Beth Scott with Rio Grande, Larry Herrera, who's also the co-chair of the legal subcommittee part of this, Larry Herrera, and also we have from Inside Out, Kathy Brua, who are here also in support.
Mr. Chairman.
Commissioner.
And let's not leave out my constituent, Albert Valdez from Vadito.
Thank you. My apologies, Albert.
Commissioners, any questions or discussion on this issue?
Mr. Chairman,
Commissioner Fambro.
I think this is a really good idea. And I also think it's an excellent idea that Commissioner O'Donnell serve as a member of this advisory board, or at least something having to do with it. But my question would be, will this have the same, help me, Bob, jurisdiction, I guess, and stuff like as the Water Advisory Board? They make recommendations to the commission. They make...
That would be a good model to think about in terms of, what does this look like? It can look like a lot of different things, but that's a model of an advisory board that we currently have.
Okay. So I guess she's off the hook. She can't be on it, but I'll find something for her to do. But yeah, I think this is a really good idea. Jana, any support we can give you if you feel this is in the right direction, I would certainly support that.
Mr. Chairman, Commissioners, Lawrence, if you or Jana could talk about, who sort of proposed would be the membership of the board, and then also I think there was some discussion about each commissioner also having a representative on the board. That would be also a good place to let the commission know.
Yeah, for board members, it would be good if a commissioner can send or give a name of a representative for somebody to sit on the board. We also want to have members from some of the organizations that we have here, detention center staff also to sit on the board, so that we're having internal and external expertise at the table so that we can meet in the middle to find out or to come up with what's best for the detainees inside the detention center and what is going to be best for them once they leave the detention center. We don't want them to get services inside and not be able to have anywhere to go outside. And if they do, in fact, come back into the detention center, we want them to have a warm handoff either way. And eventually our goal is to get them to become good, productive citizens with all our help.
Well, I agree with Commissioner Fambro. I support the effort. When will you come back to us with a proposed list of committee members?
We would like to come back to the commission, hopefully maybe next commission meeting with a resolution and some names then, if possible.
So, Mr. Chairman, Commissioners, the first order of business would actually be a resolution that legal would work with us on drawing up, and we'll bring that hopefully back to the commission at the next commission meeting. And then from there, we can go forward to getting names of individuals, and then those people will also be recognized by the commission and accepted at that point.
We're grateful to the people who have already volunteered and hope that you can formulate it in a way to utilize their efforts and have them part of the group.
Mr. Chairman, Commissioners, I so move that we approve in concept the Citizens Advisory Committee for the jail.
I'll second.
Thank you. Any further discussion? If not, please call for the vote.
Yes. Yes.
Yes.
Yes.
Yes.
Thank you.
Well, thank you for your efforts. We look forward to seeing you again. Ms. Cordova, on to some quick budget matters.
Is that a hint?
They're always quick. He's always concise.
Mr. Chairman, Commissioners, the first one I have before you is a budget adjustment for the Assessor's Office. The assessors are asking to increase their subscription and dues by $700 in order to renew the real estate appraiser's license for Nick Sanchez and Michael Mooney, and I recommend approval.
Move for approval.
Do we have a second?
Second.
Any discussion? If not, we'll call for the vote.
Yes. Yes.
Yes.
Yes.
Yes. That was A. Oh.
That was B.
That was B. We tabled A. Thank you.
Tabled A, that
Thank
was
you,
B.
Commissioner
Yeah,
Gallegos.
okay. And I had one for DWI that you don't have, so you'll see it next meeting. Sorry. The next budget adjustment then is for San Cristobal Fire District. Because San Cristobal was new, at the time we did their budget last year, we didn't have anything in vehicle, maintenance of vehicles. They now have vehicles and they need to maintain them, so we're asking to move $3,000 into that line item, taking it out of non-capital furniture and equipment. And I recommend approval.
So moved.
Second.
Yes. Yes.
Yes.
Yes.
Yes.
Mr. Chairman, the next is the DFA resolution number 23. This DFA resolution is requesting to adjust the final budget in order to establish budget for the cooperative agreements with the New Mexico DOT in the amount of $288,943, which includes a permanent cash transfer from the general fund in the amount of $72,236.
Move for approval.
Thank you.
Second. Yes. Yes.
Yes.
Yes.
Yes.
Next, Mr. Chairman, a budget adjustment for the Public Works. Public Works would like to increase maintenance of grounds roadways by $7,000. They need that for more perma-patch, for more potholes. We would take that out of street lighting, $2,000 of that. We would also like to increase safety equipment by $2,000 for more gloves and safety glasses and vests. That would come out of temporary positions, $3,400 of that. And then we need to increase our lease payments on our road graders by $2,600. We have come toward the end of our grader leases, and a couple of the units have kind of run out of hours. And so we were able to negotiate with CAT to increase the number of hours at a pretty fair price in order to keep those machines working and operating instead of just sitting there. And so I do recommend approval.
Move for approval.
Second.
Yes. Yes.
Yes.
Yes.
Yes.
Mr. Chairman, Commissioners, the next budget adjustment is for solid waste. This is what I kind of brought up earlier in your discussion. We are asking to increase the town of Taos landfill tipping fee line item by $28,610. We also need to increase temporary positions in the amount of $4,715. Along with that, the increase in health insurance for operations and administration, and we do need to increase the telephone expense by $1,200. This is going to come out of full-time positions. 23,000 of that will come out of full-time. 2,500 will come from overtime. 4,000 from para contributions. 3,620 from a uniform allowance, and then almost 5,000 from a transportation expense savings. We put this off as long as we could. We may come to you one more time with a DFA resolution, maybe to increase revenue slightly in order to meet the rest of our operational needs for the rest of the year. But I do recommend approval, and we're doing what we can. We're squeezing out every dime that we can out of this budget and the administration budget just to get through the year.
Move for approval.
Second.
Yes.
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 Mr. Chairman, Commissioners, the last one today is in our 103 account, our Admin Judicial Complex Fund. Since we have come to an agreement with our partners in the 911 in order to increase our purchase order for the remainder of the software that we have to purchase, we are asking to increase equipment and machinery by $90,000. That'll cover the difference of the Spillman. The savings that the money that we got to cover this is going to remain in the 3401 account, which we had put the money aside for this water rights transfer. So the money's still there, it's just in a different fund. We had encumbered all of the other purchase in this fund, so I wanted to keep it uniform and keep it in there, and we do have the money to do it. We're also asking to increase non-capital furniture, fixture, and equipment by $2,000 in order to purchase some recycling bins to put around the complex and to get that effort underway. And we're taking all of that out of land acquisition where we had a balance for the year. So I recommend approval as well.
Move for approval.
Second. Yes.
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 Thank you.
Thank you, Leandro. Next on the agenda is 13A. This is a discussion regarding the El Prado Community Center, ownership issues and building remediation, and I've brought this one to the agenda. This is the El Prado School on the highway across from the Torreon. It is a historic and important building in the community of El Prado, and it needs about approximately $50,000 worth of work to get it operable. Anita, if you could just you're not going to sneak out. I know I could see that, but I had a couple of quick questions for you. So in any event, we have in our packets a overhead map of the area of the school and the surrounding area. I don't know if we can get that overhead for the...
Put it on the, maybe on the...
We're going to need to.
Okay, that's okay then.
I don't think we're going to need to anyway.
While they're putting that up, Mr. Chairman, I have been in contact with a couple of the title agencies. So in order to try and find the alleged missing deed, it would be anywhere from $25 an hour to $125. I spoke with Robert Valencia, who is the facilities director at the school. He knows nothing about anything. So I'm going to meet with him on Thursday morning to teach him. He said he has a file drawer full of deeds. So I'm going to go through those deeds to see if I can locate that one deed. But, you know, this has been a 2-month process. I've been meeting with Randy. Where did he go? Randy and Abel from the assessors. And we cannot find that deed.
Well, there's, I guess, nothing in our records that are immediately available to show that there was a deed to the school district for that school. But I appreciate, so yeah, the cross-hatched area is the property that the building sits on. And then the two weirdly almost triangular-shaped areas enclosed in yellow describe deeds that we do have.
Correct.
And we've always sort of relied upon them, but they actually do not describe the building itself. So I appreciate your efforts to go to the school district and go through that work. Obviously, at some point, there was ownership. Since the building was built in the early 30s, I guess, and it was built with federal monies, I imagine that at that time, somebody had checked to see that there was an ownership in the school district before they put the building up. And so we will hope for a report in the not too distant future to see whether or not the school district actually has a piece of paper. And if they do, whether they'd be willing to convey their interest to us is another question. And if they don't, whether they'd be willing to convey a quitclaim to us to transfer any interest that the school district has but is not necessarily recorded. Once we know all of those things, then we can either proceed with a quiet title suit if there is a majority on the board willing to commit those funds. The other question I had for you, Anita, though, was I know that we have a long-term lease with the school district for this community center. And I wondered if we come to dead ends as far as the good title to the building, whether or not we could communicate that fact to the DFA and ask them if a long-term 99-year lease would be sufficient to apply for grant monies.
Mr. Commissioner, or Mr. Chairman, members of the commission, you have to be really careful about the term of your leases or the dollar amounts, because then you have to get State Board of Finance approval. Right. So that's why we try and limit our lease terms to a year. This lease was a 25-year lease that was signed back in, I believe, the 80s. And so, I know what the math is.
So it's up now, it's not current?
Oh, maybe it wasn't the 80s.
90s, maybe?
Maybe. I'd have to look at it. I'm sorry I didn't bring it with me. Oh. So I could bring that back also. An actual copy of the lease. If you would like, I can scan that lease and email it to the commissioners for informational purposes.
And what kind of grants are available for community centers? And who gets those grants?
There was a fairly sizable grant. We got $250,000 a couple of years ago for the Arroyo Seco Community Center. Bear in mind that that is our community center. We have a deed for it. But that was through USDA, and it was a Rural Business Enterprise Grant, also known as RBEG. And I did pass that information on to Monica Griego. The application deadline on that one isn't until like towards the end of May. So she does have that information. Keep in mind for that type of grant, though, your community center has to be able to be an incubator for small businesses. So that's why the SECO Community Center was able to get that money.
Okay.
I'm sorry, Mr. Chairman. Who is Monica Griego? Is she our new grant writer?
Yes.
Yay! Okay, I didn't know that.
Down there.
We stole her away from the hospital, didn't we?
Yes, we did.
Yes, all right.
Hospital doesn't need any help.
No, they don't.
So the first order of business is to see what we can do to clarify the ownership of the building, and it sounds like we have a plan in place for that. I would hope that we can bring that back to the next meeting, any information we've gotten, and then possibly discuss other alternatives or alternatives in line with whatever we find out, so that we can apply for some grant money, hopefully. We do, as I said, Richard Sanchez has provided us with a rough estimate of what needs to be done to be able to open it up as a community center. I think it's something that El Prado needs, and it's one of the few communities that doesn't have an operating community center. It is a wonderful and important building, and it's certainly a priority for me to utilize that building. And so we'll look forward to that information at the next meeting.
Mr. Chairman, I really hate to rain on your parade, but if you see, there is also a little hashtag towards the right of the screen that says Anthony Trujillo. This was an individual from the community that bought that property from Taos Municipal Schools and then built on a portion of the property that we have no deed for. So that would have to also be cleared up should we move forward to get the property.
Well, I believe that could be cleared up in a quiet title suit. You know, that's where, of course, everybody gets notified. I don't think there's going to be a big dispute within the community over that encroachment. So I don't see it as a bar to moving forward, but you're right, the title is a little messy, but there's no way that we have to leave that building unoccupied and unused. I think that there are ways that we can work through the title problems, either through getting ownership or a lease and explaining the situation to potential grantors, because I do believe that potential grantors would see the value, the historical value of that building and the potential usefulness of the building going forward. So I think if we can press on with that, we'll make some headway. Commissioner Fambro?
I guess this will be good practice when we start tackling the Los Cordovas.
Exactly.
And
Community
actually,
Center.
thank you for bringing that up. I do have the Los Cordovas, Arroyo Hondo, and the Talpa Community Center sites on the school board agenda for the 15th.
Well, we appreciate very much you making progress on this old issue of community centers. They're important parts of our community, and so we thank you for that. We do have some people from El Prado here in the audience, Catherine Cordova, and I'm sorry I don't know your name, but if you'd like to. Oh, right. I do recognize you now.
I was wondering what my school teacher was doing here. Waiting to fix my grammar if I said something wrong.
And I hit you on the head with a ruler.
He did.
We have to clear that up.
Twice. Knocked my hair off.
Well, Ms. Cordova and Cardenas, thank you so much for joining us here today. And if you have anything you'd like to present to the board now, please feel free. Thank you, Anita, and thank you, Richard, for your help on it.
Commissioners and other officials, thank you for your time. I'd like to talk a little bit about that building because that goes to the heart, you know. We are the last ones to have received our school building, which was one of the rural schools, part of the Taos Municipal Schools. And then when they closed the rural schools and bused everybody to town, all these buildings were there, and it's like, wait a minute.
When was that? When did they close that school?
They closed that in 1966, when I first came. I'm going to give you a little bit of the history of this building. I wish my husband could have made it today because he was practically raised in that building. My mother-in-law taught there for over 20 years of a 40-year teaching career. She was the teaching principal for 15 years. So I learned a lot of the history from her. This photo gallery that you have here, there is a picture back there of a play at the El Prado School. And we've recognized some of the people. In fact, Miss Cardenas' dad is in that picture. My late cousin, Valentin Martinez, is in there. And there are quite a few people who are either very elderly or have gone. So that's part of the history of that school. It was built by the community in the 30s with land given by community members. My mother-in-law even coached. Today we were watching Michael Strahan, and he said that his mother was his coach. And my husband looked at me and said, my mom was my coach too for the El Prado Gophers. So they had quite a school going. They had plays and all kinds of things. And so it was quite an active place. When the school closed, everyone in the community used to talk about the reversion clause. I guess there was supposedly a clause in that missing deed that said that if this ceased to be used as a school, it would revert back to the community.
Actually, that reversion clause is within the deed that Anthony Trujillo is on.
Okay.
One of those two yellow triangles, that's where the reversionary clause is, not for the property that the school is actually on.
Okay. But anyway, that's what the community believes. So we saw the limited purpose agency using that building for commodities, and everybody felt like, oh, good, it's being used and it's helping people, and so that was fine with everyone. Then Youth Build came in. That was fine also, because this was the young kids that were learning how to do something, and so everybody in the community was pretty happy. Then the building became vacant, and everybody started saying, oh, what's happening there? We also started noticing that other communities were getting their schools, and what happened to us? So I was probably one of the first people that went to the El Prado Water and Sanitation District. The reason I went to them was our community had elected these people. So let's put them to work and get them to help us. And we said, what could you guys do about this since you're elected? And they said, well, we'll look into it. Then when the late Fernando Medina got on the board, he decided that, I'm sorry, not Fernando Medina, Fernando Miera. He decided that that was going to be his project. He had been hearing about this from many people, and I'm going to go and try and do this. So we have to give him a lot of credit for going after this. Now, El Prado Water and Sanitation District agreed to do a management contract with the county. Our community elected board members. So we have 2 sets of elected board members in our community. No, 3 because of the acequias. We actually have 2 acequias, so we've got some elected board members there. And El Prado Water and Sanitation District said, we have enough work on our plate, but we'll help you out to get you going. And we quickly saw that we need a 501c3. So you look at that building and you say, gee, nothing's happened. That building's still the way it was. These people are doing absolutely nothing. That's not true. We've done a lot of things, but they're behind the scenes, okay? We got a 501c3. And as a writer, that was one of the hardest writing jobs I ever had to do. We had to do a virtual budget. And I remember our treasurer is an accounting major, and he said, a virtual budget? And I said, yeah, invent it. So what we did, Antonia and I came up with some functions that our building would do, because we had to have a schedule and activities and everything, and she'll talk a little bit about that. And so we gave him our activities, and he figured out a budget for it. So we have a virtual budget for 5 years, which has not worked at all. It just is out the window, but it gave us our 501c3. I keep getting teased because Lois Lerner, the lady that's always in trouble, signed off on it. And they call her my buddy. So it's okay. Lois helped us out. Now, the other thing that we did behind the scenes that probably people didn't see was we were going to get annexed by the town of Taos. And the community members got together and said, we don't want to do this. The Water and Sanitation District, again, had their plate full. And we said, we'll do that. That's going to be our project. We don't have a building. I mean, we can't really afford to do things to our building, so let's do this. So we gathered a little bit of money, and we produced some binders, and the county commissioners at the time have copies of the binders. Those of you that are new commissioners, there is a copy in the county office upstairs in the administration. So if you would like to look at that, it's like almost 500 pages. We were able to prove that we are very old. Our cemetery never had records. And this little guy from Vista Grande School, bless his heart, he was from the community, wanted to be he needed a mentor. So I had gone and done some projects with the schools, and he said, can I be your mentee? And I said, yes, I have something for you to do. You're going to help us with our cemetery. The entire community got together and we did records. So this community center has already united us, even though you don't see what we've done. We did community records, and we found that 1/3 of the people in that cemetery were born in the 1800s. So we are old, we are ancient, we're historical, and we're pretty happy about that. And we did our due diligence, and the town left us alone for annexation, at least for the moment. But it really helped us see who we are. We're going to have a history room in that building. And so all of this stuff will go into our history room so that the residents can go and also see where they came from. There was a list of compliance issues furnished by Richard Sanchez, which almost gave us a heart attack, Richard. And we thought, okay, this is a lot of money, a lot of things that need to be done. But you know what? We're not the kind of people that are going to stop. Maybe we have to do baby steps at a time. We may have to do a bake sale at a time. We're now doing a raffle, by the way. If any of you want to buy raffle tickets, we're going to be raffling off 15 items, all El Prado related, $2 a ticket, $10 a book, and the book has 6 tickets. You get a free ticket if you get a book. So we'll have the drawing at my daughter's shop in Las Pistoletas in El Prado on May 23rd. So we're trying to do a good faith effort, even if it's little baby steps. We looked at Richard's list and said, what is possible? You know what's possible? Doing those bathrooms. That's very important. So he gave us an estimate of $4,000, and we said, okay, we're going to have this raffle and try and get this $4,000 so we can start our restroom. I do have a question, though. This might be a Mr. Malone question. I don't know. Mr. Malone, do we have to have like a licensed plumber? Okay,
that would be a Richard question, not a Mr.
Oh,
Malone
Richard,
question.
okay. Well, I thought legal, maybe. Richard? Yes.
Everything electronic.
Okay. Okay. The other question, does the county do the RFP or do we do the RFP? I'd prefer if you guys would. Is that an Anita question?
Depends on the funding.
That is a legal question.
That's a legal question.
Yeah.
Oh, okay, Mr. Malone. I feel like I'm going in circles, but this whole process has been going around in circles.
Let me answer slightly more broadly than your question was. But if in the past there was some work that was done by Mr. Martinez, he helped do some work there. When it's just volunteer work.
He put tile.
Exactly.
Yes.
But what I'm saying, when it's just volunteer work and it's not electrical or plumbing, or if you had a licensed electrical contractor or a licensed plumbing contractor, if it's just volunteer work, then we don't have to do an RFP. But if we're going to pay somebody, it's a building that's under the county's name because of the long-term lease, and so we would have to do the procurement.
Okay. The other thing I'm almost done. When we were doing the history of El Prado, the Historic Preservation Office for the state of New Mexico did have a small study on that building, so I did put it in that binder. They wanted to do it because the highway was going to go through there. So they did a little study on that with a picture of the building, et cetera. So there is a little bit of a record there, which we felt made us historical as well. There are several buildings in our community that make us historical, and the school building is one of them. The Capilla, the Torreon, our acequias, our cemetery. But when I was working on this book, I also was looking for the old deed. I came to Ana Martinez, she may remember, and she was looking all over under the schools, the county, El Prado, everywhere. We could not find that original deed. Mr. Blankenhorn provided us with one, I think, from the 50s, but the original one was not there. So I called the schools. Anita, I hope you have more luck than I did. They blew me off totally. I called them 3 times, and they kept saying, oh, you'll get a call back, and nobody ever called me back. So I really felt like blown off. Maybe they had nothing to tell me, but they could have at least called and said, we're sorry, we don't have this deed. So maybe you will have better help. We have a lot of needs. It'll take us years to do this building if we keep doing bake sales and stuff, but we're going to do as much as we can. And I know some of the grant sources may frown and say, oh, you don't have a title to this building. We don't know if we want to fund you. So I think we're heading in the right direction, and we're very happy. And I would like Antonia Cardenas to come up and speak, please.
Thank you, Ms. Cordova. Thank you for your efforts. I often wondered if maybe that deed got burnt up in the fire on the plaza somehow, because it would have been about that time. Anyway, we'll find out everything we can about it and see if we can clear these issues up. Ms. Cardenas, thank you.
Hello, Commissioners, County Manager Archuleta, County Attorney Malone. I'm here today to let you know that I know that my great-grandmother, Rafaelita Gutman Valdez, the co-owner of the El Sorion Hacienda. She donated portion of the land that the building is on, and under the condition that it would be to help the community in educational or other ways. And so to honor that request, I am grateful to you for the work you've put in to help us with our community center, because we need the assistance of the county. And I just want to let you know that we want to help the community with music education for students, music therapy for our older citizens, our disabled veterans and disabled citizens in El Prado. And I'm committed to do that as long as we get the building up and fixed, and we're hoping that you'll help us in that endeavor. Thank you.
Well, thank you, Antonia. Appreciate it very much. All right. Next issue is one that Commissioner O'Donnell has brought, and it's a...
Sure.
Yes.
Are we going to go ahead and make a, I guess, is it proper to entertain a motion to table consideration until we get the deeds done?
Yeah, I don't think that we're quite ready for a actual motion at this point. We'll need some more information and then some options about how to move forward, but which we can't really decide upon until we get some more information. Thank you. Commissioner O'Donnell, you want to bring forth your topic on the tree farm?
Yes, Mr. Chairman, thank you, Commissioners. As you know, we have a 3-acre parcel on Tom Holder Road, which will eventually be used, part of it, for expansion of a road. In the meantime, I believe this represents our first agricultural property, and in keeping with that, I would like to set an example that we keep the land in agricultural property status, even though I understand we don't have to pay taxes on it, but I think it's a good example that we show Taos County that we have ag land and we want to keep it in ag production. So this is not my idea, but I think it's a good idea that we create a tree farm. And I have asked New Mexico Forestry Division to come and do a site visit to explore the viability. You know, they would determine how many trees, the spacing. Right now, I went with Commissioner Romero on Thursday, and we walked the property. And he can probably tell you a little bit more of what happened during that time. But it was French's Espinosa came, and we asked him, okay, when the road's built out, how much do we allow for right-of-way or drainage and sides of the road, and where would the road come out? And so it was roughly determined we had about a 35-acre wide area to put trees in.
35 feet.
35 feet, I'm sorry, 35 feet wide, and a couple thousand feet long that we could plant trees. There are 2 ditches on that property, the Hart Ditch and Murano. Two acequias run through that property, and when we were there, they were running quite full. One of them was the Murano. So there's, I guess, the top half is irrigated from the Hart Ditch, the second from the Murano. So we looked at the property. It's doable, given the New Mexico Forestry Division looking at it and making a site assessment. And so today, I would like just tentative approval to research this and the viability. There are grants available from New Mexico Forestry that we could partner with them and possibly other groups. And what we're thinking are seedlings. And they come in bulks. You can get 50 trees for $50. So this would be a tree farm that we would grow over 5 or 6 years, and then we would plant around the county. And we would plant them all over the county at the senior centers, maybe along the corridor of the Youth and Family Center, where it's pretty bare. But this would be a long-term project, and I'm happy to check with Youth Build to see if we can get some assistance from them planting. I'm happy to go out and plant trees. And if everything fell in line, we would be looking at a planting September, October of this year. So that's where that's at. I think possibly Commissioner Romero might have some additional information.
Mr. Chairman, well, we were out there, when was it, Thursday?
Okay.
We fought like a husband and a wife, arguing as to where to choose a building site. She wanted the whole strip, and I said, no, we can't have the whole strip because it was purchased to widen Tom Holder Road someday, and then, of course, to continue the road on up to the middle road. Eventually, those things will happen. But we did talk to Mr. French Espinosa from the MOUs Public Works Department, and he was able to give some really good advice as to how much width would possibly be used for such a project that Commissioner O'Donnell has suggested. And I think it is an excellent idea. It's a great idea. I think, one of the things that Commissioner Baroni and I had talked about many years ago if he became mayor was that someday between the town and the county, we would line all of Paseo del Pueblo Norte and Sur with cottonwoods or some beautiful trees that could be produced or grown in Taos and then eventually planted elsewhere, kind of like how our ancestors did, the Gustorfs and everyone else who's planted all these or lined these trees with these wonderful cottonwoods. And so the idea exists. It's on the table, commissioners, and I support it. I believe that collaboration between the county, the town maybe, Rocky Mountain Youth Corps could bring in other organizations that would be willing to donate the seedlings or sell them at a very reasonable price, allow for maybe 35 feet of that entire corridor to be planted with the seedlings. And then my idea when we first proposed the purchase of this land was to allow for planting of trees along that side so that they could stay there permanently. So we could allow some of those seedlings to stay there and make use of the land as a good pathway for bikes and walking. And then, of course, it would also beautify that whole meadowed area that's on the east side of Tom Holder Road. Right now, as it sits, we have, I believe, 20 feet of Tom Holder road easement. The field itself, the property that was purchased, is about 80 feet in width and then about 2,000 feet in length from the Cuchilla Hill all the way to the river. And that makes up about 3.88 acres, I believe, that exists there that the county now owns. And that's basically it.
And also, Mr. Chairman, Commissioners, all these cottonwoods were planted by Benton Bond's father along Birch Street and a lot of the cottonwoods you see. And so when we talked to, French, we could plant a permanent row of cottonwoods actually kind of to the south boundary, and then have the seedlings that would be taken out, closer to the road is what I'm trying to say. So you would have permanent row of cottonwoods that would eventually, when the road was built, would eventually line the road, but not be close enough to interfere with damaging the road and the tree, the roots. So that's what we're proposing, and if you just give me the nod, I'll continue to research it, and we'll get the forestry guy to come here, and also, after his site visit, could report on what he believes are the best trees to grow, and, you know, if that land is viable.
Thank you, Commissioners. I think it's a great idea. You know, I think obviously before we can make any, well, from my perspective anyway, before we can make any kind of a voted commitment by the county, we'd need to know a lot more details about how it's going to play out, costs and staff time. But I certainly applaud your efforts. It's a great wet spot down there that Taos County now owns, and so we look forward to future reports on that, and maybe one right now from Mr. Flores.
And I would still like a nod of a motion to just allow me to research this, not voting for or against the tree farm, but just to let me proceed. So when I contact groups, I, you know, have it in the form of a motion.
Mr. Flores.
Chairman, if I may, if this, Commissioners, Manager, good afternoon. It's afternoon. Just so that you're aware, the Heart Ditch that does serve that top portion of that parcel, I'm the mayordomo of that ditch. So in the future, if you need to get a hold of me, if you guys want to move forward in regards to watering, and in fact, I was going to come in my other capacity, and I need to meet with the county, whoever it may be, in regards to the ditch fee that is owed for that parcel. So until you pay the fee, you can't irrigate.
Good.
So, FYI.
Just costs us more money, Candace.
That's what I'm here for. So, Mr. Chairman, Commissioners, what would be, I know it's a dry year, but what would be a irrigating time? Is it just once a season, that two, I mean, how, like, say we want to start putting water on that property now, I mean, we pay our ditch fees. How far are they in arrears?
I'm not an expert in cultivating per se, but I think we're already irrigating. We already did our annual ditch cleaning. We have our annual ditch meeting tomorrow evening. It pretty much comes as long as you are paid up, just like the solid waste, you know, on your fees, your annual fees, you have rights to the water. So if those fees are current, you do have your rights. There is a schedule that I produce, and it moves down the line of the ditch. You could have the water as much throughout the year as you want, pending that it's fairly distributed throughout all the parcientes. But it really depends on the agriculture or the plants that you're cultivating. Some require more water than others. I try to irrigate at least monthly. I have a 4-acre field of alfalfa and grass, and I irrigate monthly.
And we bottle the water and sell it?
That's a whole nother issue, but that I have no...
Mr. Chairman, I would like to see something done other than letting everyone know that is an annual fire that we have every year. That field burns every year.
Really?
So I would get as fireproof trees as you can, Commissioner O'Donnell, because that's, I mean, we can put that on our calendar every year that field burns.
Well, that's a consideration.
So I just wanted to make the Commissioner and Commissioner O'Donnell aware that if this does proceed, let me give you my personal cell phone number, so you could contact me in regards to ditch-related issues. It's 77 for the record. It's 770-8631.
Mr. Chairman, so there are two acequias there where the county needs to pay those fees.
To be real honest with you, on that lower ditch, I'm not sure if there are fees associated with it pending the flow of the water. Usually, you know, if it's lower than the irrigated parcel, we'd have to do the research to see if there are water rights. What I've encountered is, because I have a ditch that runs through my property that starts on my property that I don't have water rights to because it's uphill from where the ditch starts. So I know you have water rights for the Heart Ditch, the county does. As for the lower ditch, I can't answer that.
And Mr. Chairman, did we pay a worker fee? I mean, Gabe says
No, I have the receipt for the county, and I'll schedule a time aside from my county employment to meet with the manager and just get that all squared away. But no, we clean the ditch It was posted, I believe, in the paper and on the radio. And at that point in time, I was not aware that the county had purchased it from Ms. Santi Stevan. It passed me somewhere along the line.
Thank you.
I see a budget adjustment coming somewhere in the future.
Set up as vendors.
Mr. Chairman, may I have a motion to just proceed? Or you don't think it?
Of course.
Chairman, I'll go ahead and set up a motion to give Commissioner O'Donnell the permission to act on behalf of Taos County with our management team to look at the feasibility of creating the tree farm along the property, the length of the property that Taos County has purchased on Tom Holder Road.
Second.
Clarification,
Look at the feasibility of
and what's staff's involvement going to be at this early stage?
as well.
But what is that going to be at this early stage? Do we have any ideas what we're going to be asking of staff?
Basically, it'll be you. You've had some discussion already with arborists and people that are familiar with what it takes to do something like that.
So it's mostly going to be Commissioner O'Donnell at this point.
And I'm going to vote for that.
Okay, we have a motion and we have a second. Any further discussion? Commissioner Fambro, did you have?
Well, I was just going to say, remembering our priorities and stuff, because as I walked to the meeting today, everybody was yelling out, there were 3 people yelled out the window, fix the roads, Fambro. Nobody said plant trees or fix the hospital, but they're all admirable things, so we can, and if it is additional work for Commissioner O'Donnell, I'm going to vote yes.
All right. For all good reasons. We call for the vote then?
Yes.
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 They really did yell that at me as I was walking over here today. I'm serious. Go get Henrietta to tell you guys.
Well,
On roads, and I gave her Baroni's personal cell phone, so.
Good job. I certainly don't doubt that you had some road issues, although I do think our Public Works Department is doing quite a bit with what they've got.
Awesome.
And hopefully Leandro will help us find them some more money. Number 14, legal matters. We have the potential to go into executive session. No, we don't. This is just, this is an open discussion regarding John Suazo's contract. Mr. Suazo was awarded the contract for the sculpture that we're looking forward to. Out front, Mr. Malone.
Mr. Chairman, if you would, I had asked Judge Shannon to come in because was his idea on the tree farm. We just finished the discussion, but would you just come in, if it's with your permission, Mr. Chairman, if you could just say a few words on.
And you'll be planting all the trees yourself.
I'll get out with a shovel if you want me to.
Your thing.
She does, we don't.
Well, welcome, Your Honor.
Thank you. I live on Birch Street. Good afternoon. I live on Birch Street. Those giant cottonwood trees lining both sides of the road. My landlord is Benton Bond. Mr. Bond told me about those trees. His grandfather planted them in 1908. For 107 years, those trees have been there. Because a man made a decision over a century ago to put some cottonwoods in the ground. And I'm hard-pressed to think of a decision somebody could make that affects so many people every day they drive down that street. And that street gets a lot of traffic. And those trees are awe-inspiring to people. And when you ask them about it, oh, you live on Birch Street, the prettiest street in Taos. And without those trees, Birch Street would just be another street. And my guess is everyone on this commission, from the moment they were born, has been able to enjoy those trees. So we didn't have to wait 108 years. They've been beautiful, probably within 20 years that they're being planted, that they've had an impact. And since you guys were kids who grew up here, you've driven down Birch Street, it's been an amazing street even then. That's just the power of a couple of dozen trees that a man planted 108 years ago. So I like trees. I grew up in Nebraska as a kid, Air Force brat, spent 3 years there, got the Arbor Day propaganda when I lived in Nebraska, because that's where it started. Mom's got a couple thousand trees growing out in Georgia. We got pecan trees. My brother just planted some more live oaks that should live for 300 years. And I think he's going to plant some pomegranates out there, because my mom ate pomegranates off a tree when she was a kid. So love trees. Trees are inexpensive, and they pay dividends for generations. So I'll say two last things. Greek proverb: a man who plants trees whose shade he will never see is wise. Chinese proverb: the best time to plant a tree was 20 years ago, and the second best time is today. And if you got any questions, fine. I sent some links out on Facebook to a couple of you on the nmtrees.com, and they've got a list of all kinds of trees that are available and ripe for the growing. I would add chokecherry to that list, because we got a lot of people, but we're not getting more chokecherry trees, and I like chokecherry jam. And there's also a link that I sent out to Mr. Romero and Ms. O'Donnell. I think I just sent you guys one about a week or so ago on the New Mexico State Forestry Division and their urban forestry program. So any questions, fine. If not, I think of Birch Street. Oh, I'll leave on this last point. I went out for a drive, took some pictures, don't have them, but the Llano Quemado Community Center. The Talpa Community Center has some trees, but they could probably use a couple more. I went out to the Arroyo Seco Community Center. It's got a couple of trees, it's got a playground, you got an awesome opportunity to put a park right there next to the community center. Just need some trees and a little bit of playground equipment. You got a big piece of land that's just holding piles of dirt and grass and rubbish, and a little investment of labor, love, and digging a few holes and putting some trees in, and then getting a few volunteers to water them. And if you can't find a tree hugger in Taos, then you're not looking hard enough, because this town is just screaming for volunteers to go out and help getting some trees in the ground. But I thank you for your time. I thank you for your attention. And I just want you to think about Birch Street and all the other lovely streets we have. And it's the trees that make them so. Thank you.
Thank you, Jeff. It's a great idea. You know, look forward to getting some more particulars about the trees to buy, where to plant them, who's going to plant them, and who's going to keep them watered.
Well, there is an expertise, Tree New Mexico and the Forestry Division. We could maybe squeeze something program with Rocky Mountain Youth Corps for getting those trees in the ground once we do the call before you dig work and everything else that has to be done. And three, like I said, town is full of tree huggers. If you're going to put a project in Seco, getting some Seco people to go out there once or twice a week and put a little water on the ground, and elsewhere in the county as well.
I think it's doable. I'd like to see it happen.
And a good place to start is community centers, ancianos, and some of the schools. Well, that would be a town issue until you get towards the, I think, 518. But the highway through Talpa, 518.
A lot of places.
The roads into and out of Cerro, Costilla, Cuesta, the approaches. Make it someplace people might want to stop and get something to eat on their way through Taos County. So that's just my take. But I think it's a cheap investment with a huge return that lasts generations.
Commissioner Gallegos.
Just one thing, Mr. Chair. Thank you, Mr. Shannon, for coming up. There's been some light discussion from the Village of Cuesta governing body as to right by our library and our new playground area is to have the idea of adopting a tree for families. And I think that would be an opportunity that maybe we can look at as we do this through these community centers, because sometimes they're not always being utilized, but if you put it, family has a tree there that they're adopting, and they're gonna and it's their responsibility to take buckets of water to make sure that tree gets watered. Now you get more activity in those community centers, and now you start getting that sense of families getting together and meeting, and of course you're not going to let your tree die because you've got your neighbor there that's going to pick on you. So,
well, you hope not.
We're entertaining that idea at the village. I think it's something we're still going to be discussing. So I think that maybe that's a great opportunity that this county can do that. Putting a tree farm, knowing all the stuff that's going to take to get this tree farm going, but, family members could look at having an idea of adopting a tree and.
And that's a possibility. But what you said about community and bringing the community together, if you, not getting into controversy, but just making a point, farmers market, 3 locations are regularly considered. Town Hall, the plaza, and the parking lot here in front of the courthouse. And they have one thing in common: those cottonwood trees and the shade they provide, the canopy they provide, and a sense of shelter, but the people want to gather there. And it's either the Town Hall cottonwoods, the shade and the cottonwoods at the plaza, or the ones in the parking lot right here. And really no place else is really considered for a farmer's market. And the reason people consider that is that sense of gathering in that comfortable zone, that shade that those cottonwoods provide. It's very inviting. You want to go hang out there. And so I think they're powerful things, these trees. And that was just one example of how it directs where we decide to want to do things. And so that sense of community, of being a participant, you have a child water that tree, and in 50 years, he's going to show his grandchild, I planted that tree. That tree becomes part of the family in a sense, because my grandfather planted that tree. Mr. Bond is proud of those trees his grandfather planted. Those trees are part of his family. So it's generational in many aspects.
Yeah, my wife's family was part of the tree planters, and her great-grandmother, who's 101, is still alive, and she loves to talk about those trees. So anybody that wants those, her name is Eva Cortez, I'll put you together with her. She loves to talk about what her dad did with those trees with Mr. Bond.
Well, they're wonderful. Mr.
Loves
Bond,
to talk about those
he talks about the dirt road walking home from school with the leaves knee-high, and this is before it was a main thoroughfare to avoid the congestion at Quesnel. Everybody drives down there. Now, back then, it was a dirt road, and he'd walk home from school, and the leaves were knee-deep. Of course, he was knee-deep. He's probably about that tall. Or when Mr. Bond was 6, he's a big man. He may have been 6 foot tall when he was that age. But yeah, there's stories there. There's community in these trees, and it's a long-term project. Because you're not going to see the benefits of that maybe in your lifetimes, but your kids, your grandkids, 3 or 4 or 5 generations down the road, there's going to be an impact. And it's hard to make a decision in your position that it's going to have an impact 150 years down the road. And that's what some of these decisions on trees and what you can do with them will mean. Thank you so much. You all have a lovely day.
Thank you, Jeff. Mr. Malone, item 14A.
There are 2 issues that have come up in connection with Mr. Suazo's contract that I didn't feel comfortable moving forward without getting commission input. One of them has to do with insurance. On a construction project, we would typically get builder's risk insurance. That's so that if the construction project were damaged by fire, for example, it would be paid for. Mr. Suazo, Richard can comment on that if you need more details, but Richard has helped Mr. Suazo determine whether he can get some equivalent to builder's risk, but he can't. And so the only way we can go forward with this contract is without it. And that means that we would be accepting the risk that if halfway through the project and we'd already paid, let's say, half of the money, his studio burned down and the heat caused the sculpture to shatter into 25 pieces, we'd be out that money. So I'm not telling you not to go forward with that. I just didn't feel comfortable going into a contract with that risk that we normally insure against that we know we can't insure against here. That's the first item. The second item is that Mr. Suazo wants to retain the copyright on the statue, and that would allow him to create multiple versions of it and sell them. And I just didn't know how the commission felt about that. There are 2 different ways that we could structure that legally. One would be that we would keep the copyright and we would grant back to him a license to make duplicates. That way, if we wanted, for example, to make photos of the sculpture, put it on publications, we wouldn't have to go to him to ask for that. If the commission is comfortable with Mr. Suazo being able to make and sell copies, then I would suggest that the way to do that is for us to have the copyright, but to give back to him a limited license for particular use of it.
Because he is being commissioned he's being paid to create this.
He's being paid $55,000 to create this sculpture for us.
Mr. Chairman, Rich, correct me if I'm wrong, but he has said he doesn't want, we talked about this at the Arts and Artifacts meeting, that he wouldn't do anything the same size and everything. He wanted to do smaller versions to sell wood, and that's my understanding. So if you're wondering what he was going to sell, that's what was reported.
Or if you want to do a bronze or anything else like that, Mr. Suazo.
Nothing identical.
Yeah.
But
the basic image of it. Mr. Suazo said either way was fine with him, but he would like to have the ability to reproduce it for other people if they really like the sculpture. And so, speaking with Mr. Malone, the cleanest way to do it is for us to keep the copyright so that any publications that we do, whether they're for sale or just informative, we don't have to go back to him or his heirs for copyrights and just grant him sole right to reproduce, make reproductions of it, I guess.
Well, it would be a license to make reproductions.
Mr. Chairman, the same question kind of arises with regards to the murals in the old courthouse. And I feel that if the taxpayer is paying $55,000 for this work, then we do have to retain those copyrights. It is a piece of property that belongs to the taxpayers of Taos County. That's how I see it.
Just to clarify that, Commissioner Romero, that's not giving him back a license to make duplicates. In other words, keeping exclusively to us and not granting anything back.
Duplicates may be smaller size or larger size, but never exactly the same size or same materials.
I remember that stated in the meeting. That was his intent. Nothing identical, because he understands the reason for what he's doing and why he's doing it, and so it would be something different than, it would always be a little bit different.
Because there are, in fact, people out there now that are creating postcards of the murals in the old courthouse, and they're making money out of it. The same thing with the St. Francis Church, the same thing with the Pueblo. This is, however, a government-owned, just like the murals are. And so we ought to be able to retain some sort of authority on how they are reproduced or how the image or whatever the piece is distributed. This is the way I see it. $55,000 is a lot of money.
And on the insurance, if there's no statutory bar to not having builder's risk, then I'm willing to take that chance, and just on that other issue.
Yeah, and just to clarify for the commission, on each of those two items, I'd like to get a separate vote on each of those so we have authority to go forward.
And the idea on the license, have you approached Mr. Suazo on the idea, and is he amenable to it?
Richard has had that discussion with him.
I've had several discussions with Mr. Suazo, and like I said, he indicated to me that he had no issue with the county keeping the copyright, but he would like to be able to reproduce it in another shape or size or material, and I believe keeping the license and just granting him rights to it would satisfy both parties, but it's totally up to the commission.
Sounds good. But the builder's risk, are we considering purchasing that ourselves? Maybe I didn't get all that.
Richard has also looked into that, and when we don't have possession of it, our insurance
won't cover us. And what would it cost Mr. Suazo to get the builder's risk?
Get it.
Oh, that's right.
Yeah. It doesn't matter.
His shop is on the Pueblo, which is one of the problems. And he's an artist, not a builder, and we just haven't been able to find an insurance product that will fit this need that he can get being on the Pueblo.
So do we have a motion, commissioners, to proceed without the builder's risk for one item?
So move, Mr. Chairman, that, as has been suggested by Mr. Sanchez as well, is that the county will contract with them to retain the copyrights as long as it is not reproduced in the same medium or size for a limited amount of time. He would have the permission. Is that what you're wanting?
Well, I wouldn't say the same medium because Mr. Suazo is a stone sculptor and he may want to use limestone again for a smaller piece,
Okay.
but not identical to the piece that we're purchasing. I think if there was.
Yeah, it was quite clear that he said different size, different. So.
Okay, so we have a motion to instruct staff to proceed with an agreement which would allow us to keep the copyright but license certain reproductions to the artist. Do you want to include in that motion, or you want two separate motions?
Fine to combine them.
You want to combine in that motion that we can proceed without the builder's risk policy in place?
I'm going to go ahead and allow it as, or leave it as a standalone motion, because I have questions with regards to the next part.
Oh, righty then.
I'll second his copyright motion. Yes.
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 Yes. Commissioner Romero?
Mr. Chairman, so the gentleman is getting paid $55,000 to create this piece of artwork at the Pueblo, at his residence, at his studio. Therefore, he is responsible to deliver that piece to the county, no matter what. No matter if there is a fire, if there is an earthquake, or whatever. Even if it destroys that piece, he is still responsible to create or to recreate it and deliver it to Taos County.
Legally, Commissioner Romero, he would be. As a practical matter, if he's 3/4 of the way through and he's already received substantial portion of the money, he may not be in a position to repurchase the stone. And as a practical matter, he may not fulfill it. And we would be put to the choice of whether we're going to sue him at that point. And that's not something that I personally contemplate with any sort of pleasure. And so, yes, he would be contractually and legally obligated to deliver the piece to us, but he may say to us at that point, as a practical matter, I can't do it, if that were to happen.
Chair, Mr. Malone, is it possible that of the 55,000 that would be allowed, that Suazo would get the material portion, maybe 1/4 of the pay, so that we do have still holding him accountable to be able to still reproduce that? Because, I think that the issue is like you said, you're 75% complete, something happens, it falls and breaks, and, if he doesn't have studio insurance or doesn't have some kind of homeowner's insurance that doesn't cover what he's doing, this is basically like having $10,000 at your home and you didn't tell the bank or tell the government, then how can you report $10,000 being lost at your home? So I think we got to hold him to something that's going to make sure that we get whole.
Richard has had some discussions with Mr. Suazo about the payment schedule. It was going to be progress payments, and obviously you're suggesting, Commissioner Gallegos, a more heavily weighted progress in more money being held back. I don't know whether that's viable with him or not, but it's certainly something that contractually we could do if he would agree to that.
Speaking with Mr. Suazo, and I've known him for a few decades, he assured me that come hell or high water, unless he dies, he's going to finish the sculpture. But he also is amenable to progress payments or even just having a small initial payment, which I believe the discussion we had was somewhere around 30%, which is about $16,000, and then nothing until it's delivered and set in place. His one concern is, though, that he gets started pretty soon because he needs to construct a concrete base and he wants to install it before this coming winter. So it's just something that, but yeah, he has no issue with taking 30%, 35%. We had discussions. I have to go look at my notes, but it's right at $16,000 as a deposit, and then the balance due at completion. Most projects we've always done progress payments. You know, we can do progress payments if that's what the commission wants, but keep it under 50% when the stone's there, when we've seen a rough cut, and then the balance 50% at delivery.
And all of this will be included in the contract that you're going to bring back to us at the next meeting or the meeting after?
It would. Just to clarify, Richard, Mr. Suazo, based on your discussions, would be okay with something along the lines that Commissioner Gallegos described, where there was an amount that was allowed him to purchase the stone and get started, which roughly $16,000, and the rest deferred until delivery?
Until delivery.
I would certainly recommend that if Mr. Suazo will go along with it.
Well, it sounds like that's where we're all at with you negotiating the contract. Can you wait on the builder's risk, which will also be included in the contract for our approval, or do you want us to do a motion now to proceed with negotiations on a contract that would not include builder's risk?
I prefer a motion so that we can go forward with the contract.
Okay.
So moved.
I'll second, Mr. Chairman.
Call for the vote?
Yes.
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 Yes. If there's no other business, I'll ask for a motion to adjourn.
So move.
Second.
Yes.
Richard? Yes.
Who's going to give me a raise?
Yes.
Yes.
Yes.